You, the man, I insisted, and he's the chairman of Delta State.
Okay. What's your name?
Cognitive morning.
Good morning, Prof.
Ayo, Maun.
Hello, Anisa.
Yeah. Hope everything is set.
Sir?
I want to find out from Cognitive that everything is set.
Yes, myself.
Right. Hello. Morning.
Oma open.
Yes, sir.
I think the first link is wrong, go. Because
Okay.
I think many people are on that link and they are not here. So that first link that was on the
NCP group.
flyer. So we have to find a way of getting it across to Harold. Good morning.
Okay, I'll let Shala.
Hello, how are you?
I'm fine.
Wonderful. Good morning,
Morning,
Professor
Harold.
Faborode.
Morning.
Good morning, Professor Nyirenda.
Good morning, Harold. Just call me Tom, please. I'm
Okay,
not
sure.
I'm not a professor yet, but
Okay, Tom.
yeah, nice to see you online.
Nice to see you as well online. Thank you very much for being with us. It's an honor. I would like also to present you, and it's my honor to present you also Professor Faborode as well. He's the National Contact Point leader of Nigeria. Please, Professor Faborode, if you want to say some word to Professor.
Morning, Thomas.
Hello.
Good to see you, and thanks for agreeing to be with us this morning.
Thank you very much. Nice to meet you, Prof.
It's a pleasure. Thank you.
Yeah, yeah.
And there is also Professor Ayaji, who is also here. It's also my honor to present you to him.
Thank
can
you,
say
sir.
so. Thank you.
And good morning.
Good morning, sir. How are you?
I'm fine, sir.
Thank you. Thank you very much.
Yes. So I think the first link that was sent to people is not actually connecting. So they just generated a new one, I guess, because I can see some people who said who were supposed to have been online are not here.
Oh, okay.
So let me work with them to get that one corrected.
Thank you very much.
Okay. We can get that sorted out. In the meantime, we can on the agenda.
Sure. Going to.
I hope everyone is able to upload something from end.
Yes, I'm going to.
If not, then we can make the adjustment and we will go. Cognitive should make all.
Yes, we are making you co-host already.
Yeah, all the speakers.
We are making you co-host already.
Uploading you want to complete.
Okay, so I just made you co-host, Prof.
Yeah, you have to make all the
Error.
error.
Tom, Professor Tom.
Hello.
Okay. Hi, sir.
Yeah, so you have to also. And also, this is ordering the media.
Yes, I've seen her. Okay.
What was the registration like? From our database, how many people registered?
Roughly 40.
Okay. Lydia, good morning.
Good morning.
Good morning, Lydia. It's also an honor to have you. I would like to introduce you, first of all, to Professor Faborode. He is the national contact point leader from Nigeria. Please, Professor Faborode, the floor is yours. Lydia is from the EDCTP, and perhaps, Lydia, you could present briefly yourself as well. Thank you.
As a pleasure, see you. They are joining us. Thank you very much.
And I would like also to present you Professor Ayaji as well. Ayadole Ayaji, who is here as well. Please,
Yes,
Professor.
I already greeted Lydia when she came in. I think the
Wonderful.
EDCTP means European Delegation, maybe European Delegation CTP. What does that mean?
It actually means the European and developing countries clinical trials partnership. It's too much of
okay.
a mouth.
Partnership.
You can actually bite yourself on the way and then recover and then start again.
Okay.
Yeah.
Anyway, you hear more about that from Thomas and Lydia.
Yeah, so our leaders of the association there are Professor Babatunde Salako and Dr. Camille Shorotile. You call it Shorotile? From the Health Planning and Research and Statistics. And also Dr. Olusola Ayola from Abuja. They are the representatives of Nigeria on EDCTP. I'm sure they are used to mentioning it now themselves fluently without.
Not very used to it.
Yeah.
Okay. Lydia has some delay in our audio.
Professor Faborode, if I heard correctly, we are still waiting participants to join us, aren't we?
Yes, I think there was a mix-up, so they are redirecting from an earlier link so that it's not ready.
Okay, thank you.
Probably just start because of the schedule that
Sure.
sure some of them Lydia.
Hello, apologies. I
Too much. Okay. Good to see you.
Good to see you. Thank you.
Yeah, welcome.
Thank you for the invitation and sorry for I have a little sound delay. But I'm Lydia Boudaren. I'm Senior Strategic Partnership Officer at EDCTP3 based in Brussels. Very nice to meet you all.
Thank you very much. Welcome. Okay, Cognity, can we have the program displayed so that starts now? Yeah. Okay.
Now, Lydia.
Okay, can I present about Cognity already?
No. We want to have the
program. Just show the program.
Errol has it.
Okay, I'm going to.
Errol, please, could you share the program?
Absolutely.
So you know, for this one king millions of so they so
Please mute everybody.
Your mic.
Professor Anasiala, your mic is on.
Okay, while we are waiting for the program, at least I know that the first item is to warmly welcome participants to this special webinar. Which we are having under the Horizon Europe and Erasmus program, sponsored by the delegation area. Incidentally, and have this to join us to have just some words with us later, or perhaps when we are around later in the afternoon. But I want to warmly welcome all our participants who have been able to join us all over the country. The program is the European and developing countries clinical trials partnership, and there is a current call for researchers to express interest, and we have shared this with our NCPs so that they will share with the wider research community, community airspace in Nigeria. And so our partners under the European support for the NCP network in Nigeria have decided to have this special event to popularize and to encourage NCPs and researchers to put in to this call. So this info day is specifically designed for this, where we welcome all our national counterpoints who are here, particularly those in the public health area. The coordinator for public health is traveling right now, but we join us very soon. The CMD of Aushi, the national hospital there. So he will join us very soon. It's my pleasure to welcome you all, and in particular to welcome our special resource person, Errol Lashi, who has gracefully invited two experts to speak to us on this topic. So thank you very much, Errol. As usual, I think I will allow you to come on board now and introduce the subject for today. Thank you.
Thanks a lot, Professor Faborode. I'm sorry, as I just changed, I bought a new computer and now the connection with the PDF is not good, so I'm going to go to the old one and to switch with the agenda. But in the meantime, I sent also the agenda to Cognity this morning. And if it's possible for them to show it and to share in the screen, it's okay. Otherwise, it will take just for me 5 minutes to connect to the old computer and to reach you and to share all the documents with you. Sorry for this inconvenience, but indeed, following the agenda, the floor is now after your thank you very much, Professor Faborode, for your words of welcome and presentation. And indeed, the floor is now for Cognity Advisory, and especially Omokfun, who is here to present the role of Cognity Advisory, the frame of Horizon Europe and Erasmus+. Please, Omokfun, the floor is yours.
Okay, thank you very much, Errol. I'm just quickly trying to access the agenda you shared. So let me see. So I'll share my screen shortly to show the agenda. Please, can you see my screen? So this is the agenda. Okay.
The agenda is the document 1A, please.
Okay, all right.
Thank you very much. It's among the first email that has been sent. Thank you very much.
I will just check through. Okay. So while I find that, let me go through what Cognity does so I don't delay us. Please, can you help me?
Errol is the set of applicants.
Can you see my screen? But it's so small. That's the problem. I'm trying to.
It's not displayed. Maybe we just allow Errol to continue for now while you sort that out.
Okay. Okay, so Errol, please sort that out. Then do yours, then I'll sort that out. But it's small. That's the problem. They can't see it.
Increase it. You can increase it. Position where you can put it from the first.
Just make the program bigger.
Please let Errol have the floor. I will take the presentation afterwards.
But good morning, all. Individuals can actually increase the font size.
Okay.
Expand it.
All right. If you can
just
increase
do
the
that
font
now.
size at your end, then that's fine.
It's just that this thing is written in Hungarian language. Am I seeing well? Okay. 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 Yeah. Welcome and contextual remarks.
Okay. I think if Errol is ready now, we can just proceed to the third item and then we continue because we have guests who are going to make presentation and we have to keep the time.
If this is the agenda I'm seeing, like I suggested, individuals can actually expand it.
Yes, we are just we are waiting for Errol Kulashi to. He has to change his laptop.
Okay, sir. Prof,
And
good morning, sir.
Good morning. That's the delay that is. Sorry for the
Okay.
glitch.
It's okay.
Okay, so okay, I'm wondering if you can hear me.
Yes, we are hearing you now.
Thank you very much.
Hear you.
Sorry
Yeah,
for.
so you can and then continue if the system is okay now.
Thank you very much. Sorry for any inconvenience. I just asked to have authorization to share the possibility to present. Okay, wonderful. As soon as I have the possibility to share, it will be wonderful.
Right.
So
Could you see the screen now? The PDF that I'm sharing?
Yes, yes.
yes, we can see it.
Okay, now it's,
Wonderful.
and
Super.
go on with the presentation.
Again, sorry for any inconvenience regarding this the start of a meeting. And again, thank you very much for your patience. And indeed, thank you very much again, Professor Faborode, for your words on of presentation. And here we have, among others, Professor Tom Nyirende from EDCTP and Lydia, sorry. And it's a great honor to have them. Each of them are a representative of the EDCTP from the two main continents, Europe and Africa. So they know, they are expert on this field, and it's a great honor to have them. My humble role here is, of course, to try to show you how we can find the call and partners online. Of course, we know that among the different issues that arises, having a partner is one which takes, of course, a lot of times. It's not something that we could do in 10 days. Sometimes it's months or even years before we find the right and trustful partner. So regarding my presentation, I will, of course, present you, and most of you are now aware of a funding and tender portal to show you the link and how to use it to find the call and the partner. There will be a very brief description following this presentation of a funding and tender portal of some of the main open call for proposals. And then we will go briefly through type of actions and also of a different part to complete to have a proposal. Perhaps the specificity of this call for proposal is that there are two stages and of applications, which involves, of course, not the same amount of work and energy compared to a one-stage application. But we will come to this progressively by showing you what it exactly means. Therefore, if you go to the partner search or regarding the EDCTP3 and the EU funding and tender portals, you will find out that there are a few partners which have showed their interest in being a partner of this call for proposals. To find the EU funding and tender portals, it's very easy. If you go to Google, you write EU funding and tenders portal, you will quickly find out where it is. And I have, in my previous presentation, recommended you to bookmark this link. It's the most important link regarding any call for proposals in the European Union. And indeed, when you go to the funding here of the portal, and if you have the time in parallel, and if you have a good connection, you can do it also right now. If you go to the funding here, you will find the partner search option. And in the partner search, if you write the keywords EDCTP3, to which we will come afterwards in long and in detailed manner, you will find out that there are a few institutions which are already positioning themselves to say, hey, look, we also look for partners. The first one is, for instance, when we look at this, is in the Netherlands. It is the Institute for Global Health and Development in Amsterdam, in the Netherlands. Another example is at Düsseldorf, the Heinrich Heine Universität in Germany, of course. And you have also some other Ethiopian institutions which have also marketed themselves to say, look, we are also interested to actually in the call for proposals. And again, as a main advice, I would, of course, suggest you, of course, to look at the EU Funding and Tenders Portal Partner Search. In addition, it's also to look through your network. Do you have also European or African partner institutions in your own network or in the network of your institution which are interested by the EDCTP3 and which are interested to apply for the call for proposals? And if the answer is yes, of course, that means that that you should try to present them your idea of a proposal or to show your contribution, your added value and your role for a given project. So having said this, I would like now to turn on how to find the call for proposals. I have here provided you the link in case you cannot find it out through Google. And when you go through this, you can click on Horizon Europe. And afterwards, if you insert Africa as a keyword, still on the funding and tender portals, you will find out the current call for proposals related to Africa. And among them, of course, you see, for instance, the one of EDCTP3. They are open for submissions, and we will go afterwards briefly showing you what it is about, because I don't want to overlap on the presentation of our guests, Tom and Lydia, and but briefly to show you how we use this funding and tender portal to have access to the call for proposals. Indeed, it's the EDCTP3, as has been pointed out by Tom earlier, is the European and Developing Countries Clinical Trials Partnership 3. It's joint undertaking under Horizon Europe, so it means that it's another way to have a program and to have call for proposals in a given very important thematic, which is global health. Especially focused, this one I have to mention, on EU and in particular Sub-Saharan Africa. And indeed, when we go through this, we can, when we click Africa, we have at least 10 items that we could find. There are currently 10 call for proposals related to Africa, and the biggest majority is related to EDCTP3. And the first one is here, as mentioned, the Global Collaboration Action, for the development of vaccines for reducing the diseases burden of tuberculosis in sub-Saharan Africa. You see here a very important amount of grant, also more than 15 million euros, with an indicative number of grants of 3. So that means that the budget year for 2025 is 45 million euros, out of which the contribution is around per project 15 million. And there is a number of indicative grants. So that means for the one who would like to apply, that there won't be just one proposal which will be accepted, but it is expected that there will be 3 proposals. And this is also a good information. We see also here in the funding and call for tender and proposals, the deadline, 2 deadlines, 20th of March at 17 Brussels time. So that means that if it's 17 past 1 second, it won't be eligible. The system won't accept the proposals. So better to respect the deadlines. And since it's a 2-stage proposal, there will be a second stage for 2 September 2025. Having said this, the second option and possibilities is Global Health EDCTP3 and contributing partners funded strategic training hubs for fellowship in public health, covering biostatistics, epidemiology, and modeling. And here again, we see that it's not just one winner, because there is an indicative number of grants, which are 5. The budget is also an important budget of 1,300,000, more than 1,300,000 euro. It's again a 2-stage. And perhaps this afternoon I will come a bit later on, because here it's mentioned that the funding is a lump sum grant. So at the end of a day, we will also develop what it means to have a lump sum budget, which is a key innovation and improvement in Horizon Europe, since it simplifies, in case if you win a project, the financial reporting of a project. And this is, of course, one of the key innovations of Horizon Europe that is important to share with you. Then, of course, there is also the additional action and global collaboration actions for research on existing malaria therapeutics and clinical development of new anti-malarial candidates. Again, here an important budget of 30 million euro for the collaboration between Europe and Sub-Saharan Africa, and three projects that might be funded, which means that when we have this type of projects, it's not only focused on Nigeria, but it's also focused on the different countries. It could be the West African countries, it could be the Central African countries, the South African countries, and there our colleagues from EDCTP3 are going to present us more in detail the eligible countries also in Sub-Saharan Africa. There is also a possibility, an open call for proposal for diarrheal diseases in the context of climate and health and transformative innovations in global health. And you have also additional call for proposal, for instance, on neglected tropical diseases, which is also an important aspect and dimension to consider. And there is also another one, which is regional networks of excellence and epidemic preparedness consortia. which are also an open call for proposals with 2-stage and also a lump sum. And indeed, when we find out all this call for proposals, which are going to be further, which are going to be presented in depth and with much more clarity and insight than me, with our distinguished guests, I would suggest also that when we apply for this type of call for proposals, there is also, if you go to the funding and tender portal, you can also access to the part A and part B of, I would say, your application. And for downloading your part B of the application, still in the funding and tender portal, you can go here, download part B of your templates, and you will have access to the main information related to your call for proposals, and in particular the template that has to be completed for the first stage of a proposal. And indeed, again, here, the part A is rather the administrative forms, but it's not only the administrative forms, I would say, because there are questions related to ethics that we will see this afternoon, to also budget, and this is an important dimension. I suppose that since we are talking about clinical health, there may be also ethical issues that may raise. Secondly, the part B here that has to be completed, because when evaluators are going to look at your proposals, they are going in the first stage to look mainly at the excellence of your project and also the impact of your project. In the second stage, they will, if your project is very well noted, if your consortium, I would say, is very well noted, and if it passes through, then it will be invited to present a complete proposals by pointing out the quality and efficiency of implementation, and this is what I'm going now to present to you briefly regarding the excellence and impact of part B. And indeed, when you download actually this document, the template, it looks like this: Horizon Europe program, scientific application form, Horizon Europe first stage, research innovation action or innovation action. For Horizon Europe EDCTP3 project proposal, technical description part B. This is the part that has to be completed by the coordinator of a project. What really also surprised me is and I wanted to make a parenthesis, is Horizon Europe and artificial intelligence. I was quite surprised that, for instance, there are guidance now on the use of generative artificial intelligence tools for the preparation of a Horizon Europe proposal. I did not expect this, but when I saw this, I was, well, I have to share this with Nigerian participant professors and researchers to this info day. And indeed, here there are some guidelines from the European Union. You know, they state when considering the use of generative artificial intelligence tools for the preparation of a proposal, it is imperative to exercise caution and careful consideration. Okay, this is the narrative. The artificial intelligence generated content should be thoroughly reviewed and validated by the applicants to ensure its appropriateness and accuracy. as well as its compliance with intellectual property regulations. Of course, in Horizon Europe, the intellectual property is very important, because through this type of clinical research, it's a point that potentially is highly important. And it's, of course, one has to be also careful to consider this aspect in relation to artificial intelligence, especially evitating duplication or plagiat. And that's why it is really mentioned that if one uses AI, it has to review and validate the content, the substance. And that's why it is written that applicants are fully responsible for the content of the proposal, even those parts produced by the artificial intelligence tool, and must be transparent in disclosing which AI tools were used and how they were utilized. So the transparency here is important. And specifically, the European Union makes a few points and require from applicants who use artificial intelligence to verify the accuracy, validity, and appropriateness of the content and any citations generated by the AI tool, and correct any errors or inconsistencies. Secondly, applicants are required to provide a list of sources used to generate content and citations, including those generated by the AI tool. Double-check citations to ensure they are accurate and properly referenced. Thirdly, be conscious of a potential for plagiarism, where the AI tool may have reproduced substantial text from other sources. Check the original sources to be sure you are not plagiarizing someone else's work. And last but not least, acknowledge the limitation of the artificial intelligence tool in the proposal preparation, including the potential for bias, errors, and gaps in knowledge. So I thought that this is, since we are living in the AI age, that and since I found out that there is an explicit mention in the template for applying for proposals, I thought that it's really important to share these new paragraphs with you. Of course, it's also important when you go through Horizon Europe, you will go through key definitions. And the definitions are explicitly developed by the ones who have designed these templates, and evaluators which are going to evaluate any proposals in the EDCTP3 are supposed to be aware of this different definitions. When indeed one has a proposals and implement a proposal, there are possibilities of risk, and that's why Europe first, in an alphabetical order, shows that there is, as a key definition, critical risk. And a critical risk is a plausible event or issues that could have a high adverse impact on the ability of a project to achieve its objectives. One has then to show the level of likelihood to occur. Is this risk low? Is this medium risk or a high risk? The likelihood is the estimated probability that the risk will materialize even after taking into account of the mitigating measures put in place. So here we see that on the one hand that a consortium needs to be aware of likely risks and has to point out the degree of severity of this risk, as well as if this risk occurs, to think about mitigating countermeasures to avoid this risk, or if this risk appears, to have a good reaction to this. The level of severity of a risk, is it a very important risk, low, medium, or high? The relative seriousness of a risk and the significance of its effect. For instance, there are risks also that one could not really think in advance. For instance, among them, at the end before the COVID outbreak, who could have had imagined that COVID would have could have impacted so strongly the world, and in particular the programs and the project implementations. And yes, it has pushed then people to take into account this risk and to adapt, mainly through online ways of working and implementing a project as much as it could be done so. The second key definition of when one writes proposals, it's deliverable. The deliverable is what comes out of a project. What are the products? For instance, if you have mentioned that you are going to provide vaccines in 3 years following all the development and research, then it's good to write, or a prototype of vaccine, then it's good to write that, well, this deliverable is expected in that time, and it has the following characteristics. And here, in addition, it is written that a report that is sent to the Commission or agency providing information to ensure effective monitoring of a project. There are, of course, different types of deliverables, data management plans, ethics, security requirements, a report on specific activities or results. Because the European Union does not necessarily expect from you to have a positive result of a project that you are doing. It is mainly expecting from you to mobilize all the resources that has been pointed out in your project in order to achieve this objective. And of course, in addition to this, the third key definition is impacts. And there, the European Union distinguishes 3 types of impacts that we will develop further on: the economical, the social, and the technological impact. In addition to this, there are wider, longer-term effects on society, including the environment, the economy and science, enabled by the outcomes of research and investments. And it refers to the specific contribution of a project to the work program expected impacts described in the destination. We will see with our guests from EDCTP3 that there are a work program also, and in this work program there are also impacts. Not on all the work program, but in some work program you have also destination, and the destination are key trends and key topics addressed by the programs. Of course, impact generally occurs sometime after the end of a project, but still we could distinguish short-term impact, mid-term impact, and long-term impact. Example of an impact is the deployment of the advanced forecasting system, enabling each airport to increase maximum passenger capacity by 15% and passengers average throughput by 10%, leading to a 20% reduction in infrastructure expansion cost. So we see here that they have taken an example of of an airport here, nothing to do with the health, but at least they made an effort, it has been made an important effort to illustrate what impacts look like in quantitative terms. Next, another key point is the milestones. The milestones are in a project, the control points in the project that help to chart progress. Milestone may correspond to the achievement of a key result, allowing the next phase of the work to begin. They may also be needed at intermediary points so that if problems have arisen, corrective measures can be taken. A milestone may be a critical decision point in the project where, for example, the consortium must decide which of several technologies to adopt for further development. The achievement of a milestone should be verifiable, should be checkable. So it's mainly control points in the project that help to chart progress, the milestones. In addition, another key definition are objectives. Here, the objectives are the goals of a work performed within the projects in terms of its research and innovation content. This will be translated into the project's results. This may range from tackling specific research questions, demonstrating the feasibility of innovation, sharing knowledge among stakeholders on specific issues. So you have different type of objectives, and it depends, of course, of the call proposals and of the objective of a work program. The objective, of course, has to be aligned with the call for proposals. For instance, if you apply to a call for proposals related to malaria, you need to write a project and apply for the right call for proposals, which is about malaria, and not, for instance, cancer, which is not eligible right now. For instance, in the explicitly eligible in the call for proposals. Your project objective has also to be aligned with the European and African priorities. It has to align with them, and it's really important. And the example that they have given is still with an airport. 9 European airports adopt the advanced forecasting system demonstrated during the project. And indeed, here we have an illustration of how, for instance, here the outcomes could be presented. And indeed, in contrast to the objectives, the outcomes is the expected effects over the medium term of project supported under a given topic. The results of a project should contribute to this outcome, fostered in particular by the dissemination and exploitation measures. This may include the uptake, diffusion, and deployment and or use of a project's result by direct target groups. Another key definition on Horizon Europe are a pathway to impact. These are actually logical steps towards the achievement of the expected impacts of a project over time, in particular beyond the duration of a project. A pathway begins with a project's results to their dissemination, exploitation, and communication, contributing to the expected outcomes in the work program topic, and ultimately to the wider scientific, economic, and societal impacts of a work program destination. So indeed, we will also cover this pathway to impact by distinguishing 3 main type of impact. the technological impact, the social impact, and the economical impact. Then there is another key definition, which is the research output. It's results generated by the action to which access can be given in the form of scientific publications, data, or other engineered outcomes and processes such as software, algorithms, protocols, and electronic notebooks. In addition, result means actually what is generated during the project implementation. This may include, for example, know-how, innovative solutions, algorithms, proof of feasibility, new business models, policy recommendation, guidelines, prototypes, demonstrators, databases, datasets, trained researchers, new infrastructures, networks, etc. Most project results, inventions, scientific works, etc. are intellectual property, which may, if appropriate, be protected by formal intellectual property rights. So indeed, if you are you work for a very innovative enterprises, and it is important for you to protect your intellectual property rights, such a result is surely important to consider. As an illustration of what could be a result is, for instance, successful large-scale demonstrators, trial with 3 airports of an advanced forecasting system for proactive airport passenger flow management. So this is an example that has been given in the field of results. And yes, among others, what each partners achieve are important. And following, we will go on also on showing how a project is organized. It is organized through work packages, and in this work packages, when one achieves the results and the activities that have been planned, then there is a possibility and a rule allowing to receive money on the basis of activities and results performed. So these are the main aspects that I wanted to share with you before starting to point out what is the excellence and the impact of proposals. So if you allow me 1 minute, I will turn now to an additional slide that I have prepared to you. Thank you very much.
Thank you so much, Errol. So I will just present for Cognity. Let me share my slide. Can you see my screen? Okay. This should be it. Okay. So this is my screen. And this is Cognity. Welcome to Cognity. Cognity is an African-focused development consulting firm with our offices in Lagos and Johannesburg. However, we cover the entire continent. And what we do includes can't see. Okay. Yeah. Going to my screen. Okay. So what we do includes helping by strategizing innovation and research development. We also assist clients like university, public administration, and others in managing project dissemination and positioning them in Horizon Europe. We consult for Nigerian Tertiary Education Trust Fund, also known as TED Fund, to help Nigerian research groups access Horizon Europe grants, Erasmus grants, and many more grants. We focus on integrating Nigeria into the EU research funding landscape. We do this by managing key implementation processes and establishing the National Contact Point NCP network, as well as fostering relationships with European partners to build a strong consortia. We implement program intervention at organizational and systemic levels by collaborating with private sectors and government, as well as educational institutions. So we are not limited to only universities, but also private sectors and other institutions, as well as development organizations, with the aim to drive significant change and human capital development in Africa. At Cognity, we are specialized in designing scalable programs and developing partnerships to enable us address Africans' developmental challenges. What our company does includes supporting Nigerian researchers. We do this by providing information, advice, and assist Nigerian researchers through our NCP network. We also promote European research opportunities in Nigeria by disseminating calls, organizing workshops and trainings like what we are having right now, and raising awareness of European research opportunities among African researchers and research institutions. What we do at Cognity include career development support, African research participation, impacts on projects, and communication management. We support our clients by positioning their business in areas that piques their interest. For instance, we disseminate calls in line with your interests, your career interests, and allow you to participate actively in European projects alongside other key stakeholders. Our methods include funding opportunity updates by disseminating funding opportunity updates, project idea analysis, project communication partners, research proposal enhancements, public administration support, research project management portal. And our clients includes PricewaterhouseCoopers, that's PwC, ILO, International Labour Organization, Mercy Corps, Nigeria, and National Service for Industrial Training, Senai, Brazil, as well as Enterprise Development Center, New Nigerian Foundation, and many more. In our DNA, we design and manage scalable programs and build partnerships to co-create solutions for African development challenges. Our thematic areas include green transition, that's renewable energy and sustainable development, public health, which includes empowering health systems, enhancing well-being, and improving the health outcomes through innovative research, capacity science, that's supporting Nigerian researchers by enhancing infrastructure, promoting knowledge transfer, and fostering collaboration with European institutions. And innovation and technology is our last thematic area. Here we enhance technology capability and promote innovation to drive the economic growth of Africa. Thank you. My name is Omokbo Ihenye for Cognity Advisory.
Thanks a lot, Omo.
You're welcome.
For this clear presentation of Cognity Advisory. I would like now, please, to continue the presentation on the excellence of a proposal. And could you confirm if you can see my screen?
Yes, I can. We
Thank
can
you
see
very much.
All right.
Thank you, Omo. So, as I mentioned earlier, it's a two-stage proposals, and the first stage is related to excellence of a proposal. So, what does the ones who have written these templates mean by excellence, and how evaluators who are going to look at a given proposal are going to at least formally evaluate your proposals? This is, of course, an attempt to show you how the templates are presented here. First, in the excellence, we will see the different aspects regarding the general advice to write part B. If you contribute in writing this type of proposal, make it easy to read with short sentences, clear enunciation, use bullet point schemes if necessary. Respect the rules, font size, and particularly page restrictions. And you need also to be careful, because what you send is at the end a PDF document. So if you go from Word to PDF, you have to take care that everything is in the PDF document. Having said this, the three parts of Form B, as I mentioned earlier, is the excellence through scientific and technical quality, relevant to the topics addressed by the call, and here it's the main topics of EDCTP. The impacts, the dissemination, exploitation, and communication will come in second stage, so it is too early to present this, and the implementation, which will be also evaluated in the second stage, but we will see this this afternoon. So let's focus on the first stage, which is the scientific and technical quality and the impact, and what it looks like to complete a project. Regarding the excellence, relevance of a proposal with the goals and priorities of the calls are important, and especially of Horizon Europe's EDCTP3. The soundness of a proposed methodology is there appropriate concepts, assumptions, models? Is it necessary to be interdisciplinary? Are there a gender dimension? Is it open science, including sharing and management of research outputs? These are important questions. And indeed, when you go through the template to complete directly, this includes EDCTP call for proposals, there is the excellence. The excellence means, to begin with, clarity and pertinence of the project's objective and the extent to which the proposed work is ambitious and goes beyond the state of the art. It's also good to present the soundness of the overall methodology. You see that when presenting objective and ambition, a consortium, a Euro-African consortium that includes also Nigerian partners, needs to have a maximum, not maximum, but around 2 pages here. So a work presenting the objective and ambition needs to be very synthetical and straight to the point. Briefly, for instance, describe the objective of your proposed work. Why are they pertinent to the work program topic? Are they measurable and verifiable? Are they realistically achievable? For instance, if you write that you want to have a number of important vaccines for neglected tropical diseases, but it's not realistic, then the expert will find out because they are experts of a field. Secondly, when writing, this consortium needs to describe how the project goes beyond the state of the art, what has been done so far, and what are the added value of proposal. And the extent the proposal work is ambitious, indicate any exceptional groundbreaking research and innovation, novel concepts and approaches, new products, services, or business and organizational models. Where relevant, illustrate the advance by referring to products and services already available on the market, refer to any patent or publication search carried out. Third point, describe where the proposed work is positioned in terms of research and innovation maturity. Where is it situated on the spectrum from idea to application or from lab to market? Where applicable, provide an indication of a technology readiness level. If possible, distinguish the start and by the end of a project. They also mentioned that please bear in mind that advances beyond the state of the art must be interpreted in the light of the positioning of a project. Expectation will not be the same for research and innovation actions at lower TRL, which is the technology readiness level, compared with innovation action at high technology readiness level. So as mentioned, perhaps a few additional points to stress: smart objectives and ambitions relevant to the topics addressed by the court are some of the key words. Concepts and objectives, what are the main ideas that led the consortium to propose this work? What is the overall aim? Describe in detail the scientific and technological objective and ambition, show how they relate to the topics addressed by the court, and state in a measurable and verifiable form. Through milestones, for instance. Progress beyond the state of the art. We all know that scientist has to take into account the state of the art and show what are the progresses in relation to the state of the art. So describe the state of the art in the area concerned by the consortium. The consortium has to show the advance that the proposed project would bring about. If applicable, the consortium needs to refer to the result of any patent search that has been carried out. We mentioned earlier that there is excellence in terms of objectives, but the methodology is expected to be developed as a narrative of around 5 pages. Describe and explain the overall methodology, referring briefly where necessary to the concepts, the model, and the assumptions that underpin the work, and explain how this will enable you to deliver your project objectives. If one plans to use artificial intelligence-based systems and or techniques, one must demonstrate their technical robustness. AI-based system or techniques should be or be developed to become technically robust, accurate, and reproducible. Socially robust, reliable, and function is intended minimizing unintentional and unexpected harm, preventing unacceptable harm, and safeguarding the physical and mental integrity of humans. So it is an important ethical requirements here if AI is used. If it's really relevant to a proposal that you are part of, or you intend to apply or to submit to evaluation, it is important to refer briefly to the following aspects. Is there any national or international research and innovation activities whose result will feed into the project, and how that link will be established? How expertise and methods from different disciplines will be brought together and integrated in pursuit of your objectives? Are there other disciplines coming from social science and humanities which are going to be integrated in your project, for instance? Is it multidisciplinary or interdisciplinary? For topics where the work program indicates the need for the integration of social sciences and humanities, show the role of these disciplines in the project or provide a justification if you consider that these disciplines are not relevant to your proposed project. Another very important dimension is the gender dimension. Is it taken into account in the project's research and innovation content? For instance, are you including staff and researcher from both genders? And if yes, to what extent? Are you considering populations from both genders? And if yes, to what extent do you imagine this? This has to be also pointed out, I would suggest. We mentioned it earlier. It's about open sciences practices, how appropriate open science practices are implemented as an integral part of a proposed methodology. It is important to show that to a certain extent, to what extent could you, for instance, make available the result that you achieve through these projects to the one who are not in the consortium, who are outside of this project. So it's important to a considerable extent to ensure that publication data could be shared with other peers, other research institutions, and how you do this are also important. Do you have also research and data management and management of other research outputs? Here, applicants generating, collecting data and or other research outputs during the project must provide maximum half page on how the data research outputs will be managed in line with FAIR principles: findable, accessible, interoperable, reusable. Having pointed out the methodology, we see that, for instance, the concepts, the models, the assumptions are key to present. Detailed task and work packages. It is important not to do significant harm. It is important to take into account the gender aspect and also the multidisciplinary aspects such as social sciences and humanities. Having pointed out this dimension, we see, of course, in the methodology, if you have central concepts, what are the central concepts? If you have assumptions, clearly mentions what are your assumptions. If you have models, mathematical models that you want to use to study epidemiology or something like this, then you need also to point out the main model that you are going to use. We mentioned also earlier the interdisciplinary approach. What struck me was, what is striking indeed is the importance given to social science and humanities. So one has to show if you are using social science and humanities, and if you do not use social science and humanities, why don't you use? And you know that in social science and humanities, you have different disciplines such as sociology, anthropology, political science, history, and many other disciplines, ethics. So you need to show why you are, at least the consortium, the Euro-African consortium needs to show why it is or not using these disciplines. Gender dimension, we already mentioned this. Generally speaking, in Horizon Europe, it's very important. They go up to considering gender equality plans, and they are expecting this from public bodies, research organizations, and higher education establishments, mainly from EU countries, but I suspect that showing care and attention to gender dimension in the sub-Saharan African context is also is a must even if it's not said as such, and it is very important. Open science, we mentioned earlier, open science practices do not have to conflict with the obligation to protect intellectual property rights. So for instance, if through this type of project you achieve a very important you get very important results, and they are protected by intellectual property rights, that means that it does not have to conflict with open science practices, which are rather transparent. Here it's good to know the European Commission confirms the compatibility of intellectual property protection and open science in Horizon Europe, to the extent that such an equilibrium could be found out. I would like to thank you for your attention, and without transition, I would like to present you, if you are involved in such a project, and in the first stage, what is expected also from you in terms of impact, narratives, in terms of how do you envision the impact of your proposal, or of the proposals in which you are a part of. And there, I would like to point out the credibility of the pathways to achieve expected outcomes and impact specified in the work program, and suitability and quality of a measure to maximize expected outcomes and impacts. So indeed, when we go through the template that I showed and that you can find in the funding and tender portal, the second very important aspect is to develop in the first stage of an EDCTP proposal is the impact. And impact aspects has to be taken into account. As mentioned earlier, the credibility of the pathways to achieve the expected outcomes and impacts specified in the work program, and the likely scale and significance of a contribution due to the project, and the suitability and quality of a measure to maximize expected outcomes and impact as set out in the dissemination and exploitation plan, including communication activities. But this dissemination and exploitation plan, including communication activities, does not necessarily comes in the first stage. It rather comes in the second stage of the application, provided that the proposal you are involved in is selected as a proposal which could go through the second stage. And here, evaluation criteria of the impact, there are three key impact pathways: the scientific impact, the societal impact, and economic technological impact. This takes actually around a few pages that we are going to see now through the following documents. Indeed, these formal documents as a template that has to be completed shows that the credibility of the pathways to achieve the expected outcomes and impact specified in the work program, and the likely scale and significance of the contribution due to the projects. With our distinguished guests and speakers that will follow my presentation, we will have a better insight of the work program, the goals, and the impact. So just in the meantime, and presenting the templates to complete the proposals, you see that the project's pathway toward impact has to be developed around 3 pages. Yeah? And here, the result of your project should make a contribution to the expected outcomes set out for the work program topic over the medium term, and the wider expected impact set out in the destination over the longer term. In this section, you should show how your project could contribute to the outcomes and impact impacts described in the work program and the likely scale and significance of this contribution. Projects pathways towards impact, around 3 pages. Important to provide a narrative explaining how the project's results are expected to make a difference in terms of impact beyond the immediate scope and duration of a project. The narrative should include the components below tailored to your project. And it's really evident that a project working on malaria, or working on neglected diseases in Africa, on following epidemiology, will have huge impact, not only during, but also after the end of funding. And here, it's important to describe the unique contribution your project result would make towards the outcomes specified in this topic and the wider impacts in the long term. They mention and invite us to be specific, referring to the effects of a project. State the target groups that would benefit, because if you do a project, there are target groups who are going to benefit from your projects. And who are they? Are they patients? Are they in which regions of Nigeria are they? In which cities? So since Nigeria is such a very important country in terms of population, it's very important to specify this, and it is organized in 6 geopolitical regions. It's very important to show how who are the main target groups. It is important to be specific here, breaking target groups into particular interest groups or segments of society relevant to these projects. For instance, it could be that the outcomes and impacts of your project may be scientific, for instance, contributing to specific scientific advances across and within disciplines, creating new knowledge. It could be economic, technological as well, bringing new products, services, business processes to the market, increasing efficiency, decreasing cost, increasing profits, but this is more economic, technological, and societal. Decreasing avoidable mortality, improving policies and decision making. These are the societal impact that might be expected, and only include such outcomes and impacts where your project would make a significant and direct contribution. Avoid describing very tenuous links to wider impacts. However, include any potential negative environmental outcome or impact of a project, if you think that it might have such an impact. So, indeed, here it's about mainly impacts, and I think that this capture also what is meant by key impact pathways, but very briefly. It's a good image of the scientific impact that are expected in a project, creating high quality new knowledge, strengthening human capital in research and innovation, fostering diffusion of knowledge and open science, addressing EU policy priorities and global challenges through research and innovation. This is the societal impact. Fifth type of impact, delivering benefits and impact via research and innovation missions. Sixth type of social impact, societal impact, strengthening the uptake of research and innovation in society. Last but not least, there should probably be economic impact also of new discoveries in global health. So is there a generation of innovation-based growth? Is this innovation generating new growth, economic growth? Is it creating more and better jobs? Is it bringing new investment on research and innovation? These are also what are expected to be developed in in this type of proposal writing. And again, to sum up about the credibility of the pathways to achieve expected outcomes and impact specified in the work program. There's three type of impact pathways. For instance, a clear societal impact could be what is the impact of a project on the health of society. In terms of economics, is there any commercialization? This could be also a question. And good to distinguish also impact in short term, in mid term, and medium term and long term. And also good to distinguish also qualitative and quantitative impact as well. If there is a good news regarding vaccines, how many people are going to benefit from this could be also considered and presented as a quantitative impact narrative, I would suggest. Give also an indication of a scale and significance of project's contribution to the expected outcomes and impact should the project be successful. Provide quantified estimates where possible and meaningful. Indeed, scale refers to how widespread the outcomes and impacts are likely to be, for example, in terms of the size of a target group or the proportion of that group. Significance refers to the importance or value of those benefits, for example, number of additional healthy life years is something that could be considered. And the others are what are your baselines, your benchmarks, your assumptions used for those estimates. Wherever possible, quantify your estimation of the effects that you expect from your project. Explain assumptions that you make, referring, for example, to any relevant studies or statistics. So and I finish by this, describe any requirement and potential barriers that may determine whether the desired outcomes and impacts are achieved. This could be factors or barriers arising from factors beyond the scope and duration of a project. This may include, for example, other research and innovation work within and beyond Horizon Europe. Regulatory environment targeted markets as well. So note that this does not include the critical risk inherent on the management of a project itself, which should be described in the full proposal submitted at the second stage of a procedure under implementation that we will see this afternoon. So thank you very much for your attention and following the program. And without transition, I invite, and I have the honor to invite both Tom and Lydia to present the EDCTP3 open call for proposals as well as the program. And I'm really, as you all are, impassioned to listen to our guests. So thank you very much again for your attention, and please, Tom and Lydia, the floor is yours.
Thank you very much, Dr. Kulash, and thanks for the organizers for inviting us from the EDCTP. I'm not sure whether my colleague has rejoined because I think she dropped off quite a bit, but I think we can start and then she will join us. So I have a few slides to lead the discussion. I don't know whether you can see my my screen.
Yes, we can see it. Thank you, Tom.
Great. So we already talked about what the EDCTP is all about and what it means, and thanks very much for those introductions. What I've done is just to put a few slides together to take you through a history so that you know where we are and why we are now in this stage where we are calling for new applications, etc., etc. So I have been in EDCTP for the last 20 years, and I've witnessed the way it was formed. The history really dates back to 2003, and we have here two of the key events that happened prior to setting up the EDCTP, and one of which is the Abuja Declaration, where our heads of states committed to putting 15% of their national budgets to healthcare. And later on, as you all know, there were some recommendations and declarations to have a percentage of that go to health research. A year following, we had the launch of the Global Fund, and has been on the continent for many years now, and we all have benefited from it. But even at that stage, the question was, what will happen if the interventions we are putting into good practices fail to work, or we need new ones? And that really was a motivation to go ahead with a program of clinical research that would, in parallel, be a producer of interventions in terms of drugs, vaccines, diagnostics, and at that time, microbicides, as you remember, was also one of the interventions that was heavily advocated to go into clinical development. So the program EDCTP has been on the continent for the last 21 years, and it is really a partnership between the European Union and represented by European Commission, and on one side, and on the other side, there is the EDCTP Association, which in its current form, the association, because it's by membership and invitation or application, stands to 15 European countries and 30 sub-Saharan African countries, forming the General Assembly that are the owners of the, or co-owners of the program with the European Union through the European Commission. I will describe that later if it needs more explanation. So now it has been, because the European framework programs go into 10-year periods, as you know, when EDCTP was launched in 2004, the first phase went up to 2014. Then we entered what we called EDCTP2, which will finish in 2026, but legally should finish in 2024. And in 2021, we had establishment of the third program, EDCTP3, for which we are meeting here today, and that will go on until 2031. It is a program that builds on the two programs that I've mentioned and really is there to foster advances through global goals, for example, the Sustainable Development Goals. But we also have the EU Global Health Strategy, as you know, which it aligns with, as well as, of recent, the AU-EU Innovation Agenda. So, as I mentioned, the association as it is at the moment, you can see them there, the 15 European countries and the 30 African countries, of which Nigeria is already a member. You'll see in my subsequent slides that a country needs to be a member for its institutions to be eligible to receive funding. But this is not the end of the process. We hope many African countries will be able to join, and we do help them ourselves with the process. You can see there is Angola and Switzerland that have one leg in. We call them aspirant members. There is some paperwork they need to finish, And some of it is to do with the political discussion that is going on in the country, etc., etc. But we would love that all sub-Saharan African countries, in fact, now, not just sub-Saharan African countries, but African countries, as you will see later, if I come to mention it, we have already in Horizon Europe some Northern African countries like Tunisia, which are also eligible to get EDCTP funding. So what is the strategic approach? The vision is really to reduce the socioeconomic burden of infectious diseases in sub-Saharan Africa by promoting development and uptake of new or improved health technologies, as I said. And it is there to increase health security in sub-Saharan Africa, and by doing so, also addressing global health security and strengthening really the research and innovation capacities in Africa as well as in Europe and elsewhere to respond and control infectious diseases. So the mission is to support global collaborative research, capacity strengthening, and international initiatives to accelerate the development of the interventions I mentioned, but using the disease burden in sub-Saharan Africa as the base. The strategic approach has 5 pillars. The first pillar is to advance those biomedical interventions I mentioned about in 3 categories, but there's also a pillar for developing research capacity, especially in Africa, where we need to elevate the research capacity so that the partnership is meaningful. It's not on a slanting ground. And then the third pillar is enhancement of coordination and alignment around countries that are part of the partnership and those that come on board. The fourth pillar is strengthening capacities for outbreaks, epidemics, and pandemic preparedness. And the last pillar is fostering networking and partnerships. You'll see that some of the calls that Aero presented are really about fostering networks to address the other 4 pillars that come before them, especially in Africa, where South-South cooperation has been a weak component of clinical research for numerous reasons that we can think of, including division of Africa to align along historical colonial links. So the scope is really about infectious diseases. But now we can't talk about infectious diseases without issues like climate crisis, etc., etc. But we tackle all stages of clinical evaluation of products that can become life-saving. And then, as I said, we strengthen capacity, especially in sub-Saharan Africa. So this schematic approach provides you really basically how we conduct business. So at the center of it is clinical research, funding clinical research. But we can't do without the blue part, which is research enabling and research supportive environments, having trained people, fellows in place, and capacitating ethics committees and regulatory national regulatory agencies, etc., etc. So in terms of this new program, as you can see, there's a big budget for the next 10 years, and this is comprising different parties contributing. As I said, the major party is the European Union through the European Commission, but you can see here our association also expected to contribute at least half of what is coming in from the European side. But now we also have contributing partners and partners of the EDCTP3 through what they call the joint undertaking. And that's why you have the Bill and Melinda Gates Foundation, for example, BioNTech, for example, being part of EDCTP3, which did not happen before in the last 2 phases that I talked about. just to give you a flavor of where we're coming from and how we join now with this new phase. So you can see here from 2004 to 2024, we supported almost 700 grants, and these grants of different sizes and shapes. What we call coordination and support action will be kind of networking grants, etc. But you can see over 200 of those. And then what we call research and innovation actions, which are multi-center, multi-site clinical trials. Some of them are as large as 40 million euro grants, like the CEPI studies we have in West Africa, in Nigeria, Liberia, and Sierra Leone, and the TB development, drug development consortia of 30 million euros, for example, coming down to smaller ones up to 3 million euros or so. So 206 of those. And then, as I said, training people, developing people, 262 grants that have developed fellows. So that was like a 1 billion spent. And now we are in EDCTP3, as I said, that started in 2021. And they already from 2022 issued a number of grants, which you can see there, overspent of close to 300 million euros, and with that kind of division in terms of the types of the grants. And so now we're talking about the work program for 2025, in which you are very much interested. So this work program was adopted by the governing board of the Global Health EDCTP3 joint undertaking on the 13th December last year. And it includes 4 calls covering 7 topics. And in addition, it includes also mobilization of research funds in cases of public health emergencies. The total initial budget was 214 million, but as you will see when you go on the course website, there's been adjustments because of new funding, new partners coming in who are interested by subject. So this is a slide that was also presented in the info day, just to present to you the 7 calls under 4 subjects that I have talked about. You see in category 1, there is 3 calls, one talking about development of vaccines for reducing the burden of TB. We still haven't got a very good TB vaccine, although BCG works. There have been so many studies in EDCTP1 and EDCTP2, some of them trying to boost the efficacy of BCG, some of which coming with new candidates, but no definitive answer has come out. So that call is addressing that area. Then we have another one trying to research existing malaria therapeutics. And this again is an area where we know now there is new malaria vaccines, for example, that have come in, like RTSS, and then you have the R21 matrix being studied in Burkina Faso. How do they work with the malaria therapeutics, and what can be the new strategies that can help us fight malaria? That's the call that is talking to that. Now, in that category, the last call is on NTD vaccines. Now, when you go to this call, pay attention to the pathogens that have been listed as eligible. So, because for you to be successful, you need to propose development of vaccines in the pathogens that are in the remit of the call. Then we have the 2 calls that also came up in the presentation that Aero did. The first one is the formation of strategic training hubs for fellowships, covering biostatistics, epidemiology, and modeling. This is a core that we work very closely with the Africa CDC, And the idea is to help beef up this manpower that can bridge research to epidemic preparedness through collaborations or very close working relationships with national public health institutes or the resident CDCs, like you have the Nigerian CDC, for example. And I know, Eri, you talked about 5 projects, but because of the interest from other parties, there will be quite an increase in the number of consortia that will be supported under that call. Then we have the call for networks. I did mention about our weakness in the region about networking. From EDCTP1 through EDCTP2, EDCTP has supported 3 rounds of calls to regional networks of collaboration. And by design, these first funded networks were in the 4 African regions of Africa. East Africa Community had its own network. Southern African Community called SADC had its own network. The CIMAC region of the 2 Congos, Cameroon, Gabon, had their own network, and ECOWAS has its own network called ONETAM, which you probably know, which is headquartered at IRSF in Dakar. So the idea of this core is not to fund the same things that were funded, but to build on what EDCTP invested to revamp and reformulate the networks so that they are inclusive. What do I mean by that? That they take into account the global collaboration. This work plan is strong in global collaboration. So we have partners on the continent, like CEPI. We used to have PEPFAR, which probably will not function in the same way. And we have other agencies that have invested. And the question is, how do you embrace all these past investments and new strategies that can help our Africa Union have a strong presence and mandate in every disease control and research? And so with that example, you can see that some of the networks may not be, the way they are now, or they may have a better reach in terms of piggybacking on institutions from other regions that may complement or strengthen what they thought they were lacking, etc., etc. But we will still fund 4 networks to the minimum funding of 10 million euro per network, and the budgets are being increased because of other partners' presence and interest in that as well, just like the other call. And then the last but one call is the Global Collaborative Action in Tackling Diarrhea Diseases. Just like the other call on NTDs, if you are interested in this call, pay attention to the pathogens that cause diarrhea, that EDCTP has seen that there's a gap where this research needs to be developed. So it doesn't include everything that causes diarrhea. You have to go to the core and see which pathogens are addressed. And if it's one of the area of interest for your institution and you have work ongoing on that, which you want to develop further, this is an opportunity. Then there's the last call, which is transformative innovations in global health. This one is a call that also you have to read it line by line to understand what is really required. But in general, it is a call that is looking at repurposing the low-hanging fruits. There are some interventions that probably have been abandoned on the way for some reason, but they have a potential for life-saving. And you really need just to take them from where they stopped to develop them into interventions that can be made accessible to the populations. So it's about really looking at the low-hanging fruits. That's why when you read in the core, there's guidance that it must be a product that has already proof of principle, and what you're saying to EDCTP said, hey, this is a lost opportunity. If you give me money to develop this further, this can save more lives. And then lastly, just to mention, as I said, there's already 1 million on standby in case of another public health emergency. Something like this has already happened between the time EDCTP3 started and now, and that was Mpox. And EDCTP quickly responded to that with a 12 million euro core funding to fund Mpox studies in a number of countries which are ongoing. So it always now is our thinking to have that component included. Now, Ero talked about eligibility criteria. This is very important because if you go into the writing of the applications, but you don't know whether you're going to be eligible, it will be a waste of time and resources. So first of all, the institutions that are eligible to get EDCTP funding are in the EU countries, member states. These have automatic qualification. Any institute will be eligible to get funding, as well as what they call overseas countries or territories linked to the member states of the EU. They are also eligible. You will see this in the core text, also in the work plan of EDCTP, which is on the website. These are described by name. And then we have a second category of non-EU countries, and there are three types. There are countries that are associated to the Horizon Europe. So, for example, in Africa, I mentioned Tunisia, that is now accepted is in Horizon Europe. They are eligible to get EDCTP funding. And there are countries which are members of the association. I gave you a list of 30 countries that are current members of the association. So in your consortium, if you include a country outside those 30 in Africa, they will not be automatically funded if your consortium is successful. In other words, somebody or some institute or a country have to find funding for their participation. And that's where the challenge can be. And then there are other countries that can be part of eligible countries that if they are non-EU countries, but they have to be exceptionally mentioned in the course. So I don't remember any of those 7 calls pre-selecting a country which a disease burden, which is outside the remit of eligibility that has been mentioned. But there will be circumstances in future where this can happen, where a country X will be mentioned that it needs to be included in the applications because of its importance. Then there are specific cases that eligible entities can also be mentioned, and this applies to certain EU bodies and international organizations. So you will see that in this work plan, for example, international research organizations with headquarters in Europe are mentioned as eligible to get EDCTP funding. So if you have that in your consortium and you're thinking about that kind of institute because they have an expertise that you want, then that opens up an opportunity to include them in your consortia. Now, the eligibility also goes beyond where the legal entity is registered. There is a minimum number of institutions that form an eligible consortium. So here they are. First, at least 3 entities independent from each other is a minimum limit for formation of a consortium. What does it mean, independent? For example, if you have 2 sites in Nigeria that are run by the London School of Hygiene and Tropical Medicine, they are under one domain. So you cannot include them as independent. They are not independent. So they have to be independent institutions. Secondly, at least one independent legal entity must be established in a member state or associated country that is a member of the EDCTP association. So because it is possible that you can find two entities in two separate EU countries and then an associated country linked to France somewhere, it can be an island somewhere, and also another country, they will all fit, but if there's no at least one independent institute from those members of the EDCTP association, then it becomes an eligible application, if you see what I mean. And then lastly is that at least one independent legal entity should be established in a sub-Saharan African country. By design, the research needs to happen, a back of it, in sub-Saharan Africa where the disease burden is. Although there is already work package work that can be assigned to partners outside sub-Saharan Africa. But in this case also, less qualified is Africa, because if there is now a country that is in Horizon Europe, up the Sahara, they are also eligible to get funding. Now, I think Ero went through this already. So these are two-stage applications. First stage, which is a shorter outline of a proposal, has only two criteria of evaluation, which is excellence and impact, will be quickly judged, and then, if successful, will be invited to the second stage. And as you see, it's by invitation only, and then a full proposal has to be developed. At that time, you can make changes to your consortium and allow changes of the coordinator. You'll see some of the calls. The EDCTP offices in The Hague and Africa, where I am, can become a coordinator of some of the programs. And at that point, you can include them. And then they will also be evaluated, but now around 3 criteria: excellence, impact, and implementation. So this is the calendar that we foresee this work plan will undertake. The core topics were pre-published on the 10th of January this year, and the calls were opened at on the 30th of January. And we did have an info day like this online for everybody on the 11th of February, and the first stage submission deadline is 20 March. And then we expect the evaluations to take place around April, May. Then there will be internal approval of the evaluation outcome in June, which will then be communicated to all the applicants in July. And then they will be told those are going to the second stage of the deadline, and then they have to comply to that to submit a full proposal. Those full proposals will be evaluated between September and October, and then there will be internal approval expected by December, and the stage outcome at the same time in December be communicated to all those that came through to second stage, and those that are successful will undergo grant preparation and contracts with the EDCTP. So that is what I prepared for you in terms of the calls for applications. This slide just gives additional information that every 2 years, EDCTP has a very important gathering, which we call EDCTP Forum, which brings together people, scientists, institutions, country representatives, policymakers that are interested and have had their countries or institutions receiving funding before, but also partners that work with EDCTP funded institutions, centers, and scientists in one way or another. will also participate in that forum. It's kind of a big conference, and last one was in 2023 in Paris, and this 2025 one will take place in Kigali on those dates indicated there, 15 to 20 June. And this is another opportunity to continue the discussion. And I think by that time, as my calendar showed there, that will be the time when people have submitted the first stage, and then they'll probably have received their outcome, and then they'll start talking about how to now put in full proposals and submit by September, etc., etc. So let me stop there. Thanks very much, and be happy to take questions. I'm not sure whether my colleague Lydia has now rejoined, but if she's not, I'll attempt, if there are questions, to answer by myself, and then she can join us when she's ready. Thank you.
Dear Tom, thank you very much for your passionate presentation. It has a lot of insight, I would say, regarding the history, the opportunities, the program, the two-stage places, the conditions of eligibility. I'm very happy since I have listened to all your insight, and I'm sure that the Nigerian research and innovators, including the one in health and clinical health, have also a lot of questions to ask to you. Perhaps I would like to start by asking two small questions. The first one is, how would you see the link with Horizon to Europe? Because you have Horizon to Europe, you have a joint undertakings. How do you see the architecture, this architecture? And the second one is, I think, related to the partners and the partnerships. And I was wondering if you have any advice to share for how the Nigerian research and innovators in the field of health could have partners in Africa, in sub-Saharan Africa, and in Europe. Thank you very much again, Tom. Thanks a lot.
So if I may respond to that, thanks very much, Carol, for those questions. Indeed, this architecture, as you mentioned it, may be straightforward to people like yourselves, but not to everyone. And really, just to say that the whole Horizon program is a much larger program, and the support that the EU has through the European Commission to these programs is much, much larger than just EDCTP Global Health joint undertaking. And so when one is looking at the opportunities for grants, it's better to look wider, because it could be that the same application you were intending to submit to Global Health EDCTP can also apply to other Horizon cores. And I've seen quite some applicants also being successful in that, because within the big Horizon program, the EC will also look what gaps are there, and some of the programs that EDCTP cannot at that point in time address will be taken over and will be supported. And it's not just through calls for application outside EDCTP. This is a unique thing about the Horizon, the way I see it. And it was the same with 2020, Vision 2020, is that while organs or instruments like EDCTP focus mainly on awarding grants based on competition, there are also other programs that composite outside like for example here in this the EDCTP joint undertaking by issuing grants specific to programs that are also very relevant to EDCTP. So you will find that the EU is a big supporter, for example, of the African medicines regulatory harmonization, which takes place mainly with the leadership of Auda Nepad on the continent. And there will be a supporter of programs that are setting up African Medicines Agency. But at the same time, EDCTP will support through grants regulators in countries to strengthen themselves, who in future will be very instrumental to making the African Medicines Agency stronger. The same applies to pandemic preparedness, and programs under HERA, for example, will have their own programs supporting the Africa CDC directly. But we work with Africa CDC to support scientists that have got good ideas through a competition. But at the end of the day, we are all trying to achieve some components of our Sustainable Development Goals. Now, in terms of partners, again, that's another big challenge, especially for, I understand, if you're coming from an institute that is not research heavy and your partnerships are thin, it's a big challenge to get involved. And you really need to have within your institute spare pair of hands that can take up this role of looking out and reaching out and getting partners that are like-minded, and then you can piggyback on you, because usually also even big partners don't understand what is going on inside the small institutions, inside small centers, but there's no one to connect them. But they would need those capacities to enrich their applications. So what we have done for the two calls, the one on networks and the one on training, we have actually produced a page, a web page, where we have published guidelines and also a list of networks and their websites that have contacted us. They will be interested to apply to this call. And we are still continuing to list institutions that are also contacting us. Now, the aim is to have people talk to each other, networks talk to each other, institutions talk to each other, while they are putting together these applications towards the deadline of submission of 30 March. It may not be the best, but this is what we can do at the moment. And I think what you showed us, Ero, of institutes that register on the Horizon page as always able and ready to network with others, this should be encouraged. And so we need to have a database that is huge than what you just showed us, because this is a big weakness now in the area we are having. So I can tell you that when we started the regional networks of EDCTP, to convince a lot of people who were part of the applications that this core is not for competing, this core is for working together, even that mindset is very difficult to defeat, because those who have thrived on being known as the best, they've done that through competition, and they would want to continue compete with others. But we really need to also dump down that feeling at one point and showcase the importance of working together other than competing, and then maybe compete later. But this needs special focus. And that's why I think that page that you showed us is very important, but we really need to have a broader strategy that, people should need to find each other very visible. It shouldn't be blind dating. It should be really There should be visibility of who is doing what, in what area, what strengths do they have, what kind of opportunities do they have, etc., etc. So it should be broader than what I've just described in summary. That would be my answer to your question. I don't know whether it answers what you wanted. Yeah.
Oh, yes, thank you very much. It has so many insights. Thank you very much for your answer, and again for your passion for this. Very happy to listen to you, and I know that there are also other colleagues who would like to ask you questions, and I'm also happy to have heard from you that at least this program is going on, the EDCTP till 2031. If I'm not mistaken, and that means that it's not just a one shot. So that means that if a Nigerian institutions here would like to have a strategy to internationalize in clinical, in this clinical health, they can do this if they have a strategy and include progressively, as you mentioned, the different networks and also create also a capacity, which I think is so important, to have a capacity to reach out to other partners is also something part of this strategy of internationalization, I suppose. Yeah, thank you. I don't talk, I don't, I prefer to leave the floor now to
yeah, just while you're leaving the floor to others, because you have touched on another very important subject. So EDCTP is a partnership. So I've showed you a club of 30 African countries that are participating. The representatives of those countries are selected by countries to be put on the board. That's why we publish these names on our website, so that they are very transparent. You know who the people are. So I did say that Professor Babatunde Salako, Dr. Olusola Ayuola, they are part of this leadership. And you have touched on a very important subject, Errol, is that if the scientists in Nigeria feel that EDCTP is not helping in advancing research in their country, these are the people to talk to, so they can bring these issues at the board level, at the General Assembly, and then they can go to their scientific committee and say, this is the gap that Nigeria sees, so that the work plan like this in 2026 can have Nigerian input. This is the way. This is the way that the partnership works. Yeah.
Wonderful. Thank you.
Yeah.
Thank you so much. Now, again, thank you very much for your insight. And now I would like to turn to the Nigerian research and innovators and participants here, with the help, of course, of my colleague from Cognity Advisory, to give them the floor and to have the floor. I see that here also Professor Adamu is here. He is the national contact point for health, and if he is available, he can also present himself next to you, so that there is also an exchange. Professor Adamu, oh, thank you very much. Thank you very much. Please, this is Dr.
Thank you.
Komilenda from EDCTP3. Thanks a lot.
I'm sorry for joining late. I think I will just thank you for whatever you've been doing. I followed a little much later, but I want to appreciate TED Fund for ensuring that this program is going on, and Cognity Advisory for providing the advisory role. We have gone far. We are yet to get any grant, but I'm sure after this, we'll be able to get many more grants. I'm sorry once again for joining late. I had a very impromptu meeting this morning. That's why I had to leave from my place to another place. I'm actually at the place where the meeting is ongoing. If you excuse me, I will be very glad. Thank you, and may God bless us all.
You're welcome.
Thank you, Prof.
Thank you,
Thank
sir.
you, Prof.
Thank you very much, Professor Adam. So now, Omokpo, could you help me please to to have to give the floor to the different participants here, which have
All right.
questions to
Okay.
Dr. Tom Nierandes, please. Thank you very much.
All right. Thank you,
Don't
Dr.
be
Tom, for
shy
your
and raise your hand.
presentation. And we learned a
And
lot.
I see my
Yes,
colleague
Dr.
Lydia is
Ngozi
also online. Yeah.
all
So
right.
Lydia,
Okay.
please
Okay. So
also
please
chip
let's
in.
have
Yeah.
Lydia. All right.
Right. Thank you so very much. Thank you, Aaron. Thank you. I'm not able to pronounce the name. Forgive me. But the presenter that presented for EDTC, I'm yet to get used to some of these terminologies. So I really would like some more clarification. I think it's a network problem, but the particular area of interest for me is when he was talking about, well, it was in response to Errol's comments, and it really benefited me. He was saying something like, yeah, you could prepare this one proposal for this particular program, but you could also submit it to some other programs. Please, can you help us with those other programs that it is possible to submit the proposals to?
Yes, no, thanks, Prof. So what I was expanding on is how broad the EU programs are under Horizon.
Please, pardon me, can I ask the second part of the question? Sorry, so that you take it at once. The second part of the question is because I've actually seen the number 3 call, and I was really very interested in it. I started gathering together a team. I thought of, in fact, I actually contacted a government agency. But now that I have this opportunity to ask, are government agencies qualified to be part of the consortium? And are there any particular roles that will be they are allowed to play, or yeah, that's something I would like to know. Participation of government agencies, is it allowed? Thank you.
Thanks, Prof. I'm sorry for interrupting you earlier. So in the first elaboration to Errol, he asked me, how do I see the relationship of what EDCTP is doing to the other broader Horizon platform? And I was just agreeing with him that the EU support in terms of getting proposals and supporting science is not just through one instrument. EDCTP is just one, but the European Commission will also issue calls for application under different subjects. And so it could be that, for example, if you have a submission under EDCTP that is related to what the EC codes will issue in future or around the same time, but they are complementary. You could actually just modify one application and submit it on the other side as well. It's just that the funding instruments are not just one model. This EDCTP joint undertaking is a particular subject, specifically on infectious diseases and pandemics. And you will see that non-communicable diseases, for example, are only fundable if there are comorbidities of infections. But if you have interest in non-communicable diseases pure, like cancer, heart disease, you may submit them elsewhere. And there are opportunities within the European Union calls for applications that you can do that. So that's what I was trying to elaborate on. And my colleague Lydia may add on that as well, because she's inside and she has a better understanding of the commission because she works from inside there. And in terms of government agencies, yes, they are eligible to get grants. And the only eligibility that really counts is whether they are in a member state that is eligible. So now, because we're not talking about Europe, let's talk about Africa. So in Africa or sub-Saharan Africa, eligible countries are countries that are members of the association. So currently, Nigeria is a member of the association of EDCTP. So all the government agencies in Nigeria are eligible to get EDCTP funding. And they can take up a role that is assigned in the consortium. And that role is assigned by the group writing the proposal. So you'll see in this course, if the role is scientific coordinator, that means that institute, it could be Nigeria CDC, or it can be Ibadan University. Once they is given that role, it will be the leader that would help all the consortium members in Nigeria and outside Nigeria to put the proposal together, put the work packages in, and cost them so that the coordinator that will be handling finances in the consortium is also comfortable who they will be paying, etc., etc. So that is really open. That's why for the call, for example, for strengthening ethics committees, you will see that the FDA in Nigeria is a recipient of EDCTP grants. And that by virtue of being registered in Nigeria. And we will want to see even more and more institutions being part of this kind of arrangement. I hope that answers your question, Prof. Prof, you are muted.
Okay, so she can unmute herself.
All right, okay. Yeah, I want to thank you so very much because you really very well addressed the issues I raised, and I'm very grateful because now I am sure that I'm on the right path, and by God's grace, I'll continue with the arrangements I'm making. Thank you so very much. Thank you, thank you, thank you. And I hope if we have a need for clarifications or further guidance, we'll be able to reach you. But how do we do that? Through Cognity or directly or through Aaron? How do we do that, please? Thank you.
So, Prof, I've just typed my email in the chat, and maybe my colleague can also do the same.
Okay, so we have other questions. Yakasa Izena, please,
Thank
let's
you
have
so
you.
very much. I'll take your email address. Thank you.
Thanks, Prof.
Zaina, please go ahead with your question.
Hello.
I've asked you to unmute.
Hello.
Yes.
Hello.
I can hear. Who is that?
Yes. Yes. Good afternoon.
Good afternoon.
Yeah. Thank you very much, Errol and Tom, for your presentation. My question has to do with, because I saw from the call 4, the Horizon Europe call 4, that has to do with transformative innovations in global health. So I don't know the coverage for that very aspect because my own research has to do with the risk reduction strategy of chemical pollutants in wastewater used for crop irrigation. in developing countries as a whole. And I don't know if that one will come under, because the one I am seeing for the health here has to do with the diarrhea diseases, epidemic preparedness, and also epidemiology. That was what I saw. So I don't know if there is a room for chemical pollutants, the management of chemical pollutants in wastewater used for crop irrigation in developing countries. The thoughts we have here, or what I have experienced here in Nigeria, is that most of our agricultural produce being produced during the dry season, when there is no rainfall, most of the rivers are contaminated with the chemicals, with wastes now from industry. And unfortunately, the farmers take advantage of that wastewater directly and irrigate the crops. So we have tons of tomatoes, oranges, or let me say the perishables being cultivated with wastewater containing some chemical pollutants. So is there any room whereby the risk reduction strategy will come so that we can inform local policies on what to do? Because I got a patent from England where I studied, and we actually looked at wastewater that is being used, the treatment processes of wastewater being used for crop irrigation using agricultural biomass. It was so succinct that a patent was granted for it, and we are in the process now. So we are trying to develop that now into a product, and that is part of the work in which we are doing. And with that also, we're looking at the quantitative chemical risk assessment. We're trying to see the possibility of coming up with some local policies that could aid or will support the WHO and the FAO guidelines for crop irrigation, because the people are actually suffering. The typical life expectancy of Nigerians in same thing as developing countries is reducing. Now Nigerian typical life expectancy ranges between 40 and 55 years. So part of what my research looked at or considered was there either cadmium or lead or certain heavy elements, carcinogenic elements that are not supposed to be in wastewater, and they are found there. So some hospital waste are being deposited directly into the rivers, and the rivers are being used by local farmers who are ignorant of the chemistry taking place upstream. And they take advantage of that one to raise the crops, and people are eating, and the cancer rate is high now in the country. So the research is attributed to that, and we are coming up now with a risk reduction strategy for that. So I wouldn't know if the Horizon Call 4 under transformative innovation and global health can accommodate our submission. Thank you very much.
Thank you very much, Prof. Sadiq. I will attempt to answer and pass on to my colleague Lydia, because she's there in the EDCTP3 Secretariat. The way I have understood your explanation, I would say this is out of scope, because the EDCTP program targets infectious diseases. And so if it is only about chemical pollutants, that means it is out of the scope of EDCTP. But if you want to link that to the argument that that pollution leads to more diarrhea, more other infectious diseases that EDCTP targets, or makes antimicrobial resistance worse, those are the areas that are under the remit of EDCTP, and that has the relevance. But just on toxic waste, it is out of scope. I don't know, Lydia, what's your take on that?
Yes, I fully concur with what you're saying, Tom. Indeed, it has to be linked to infectious diseases within the scope of EDCTP, and indeed that call really makes that scope quite clear. So if there is any link you could bring into the project, that would be fantastic.
Did Professor Mohammed, did we answer your question? You're happy?
There is a way in which we can still link. So we can drop the aspect of the toxins and then look at the microbial aspects. So it's still possible. Thank you.
Yeah, perfect. If it is about microbial ones, then yeah, you can link, because there are pathogens or those diseases listed in the work plan of EDCTP that you have to motivate and say, this makes this disease worse, or it makes it, it's therapeutic. It makes it better, it eliminates it or whatever, but it has to be around clinical research. And also remember, EDCTP is an inhuman funder, inhuman research funder. If you only talk about doing research in animals, it becomes, or just in the bench, in a lab, it becomes questionable and out of scope, unless you motivate it really well. But this is about inhuman research for saving lives. Yeah, thank you.
Okay, so let's have the next person, please. Professor Aboy Madaki, could you ask your question? I've asked you to unmute yourself.
Hello.
Prof. Aboy. Okay, if you're not there, can Professor Zainab take her question? Okay, I can't find her on the meeting again. Maybe we lost her. Professor Ajayi, please have your question.
So thank you, Errol, and thank you, our people from EDCP. Well, I know I'm speaking maybe on behalf of the NCP. I know Professor Gire is there already. But what we actually, one of those key things we like to achieve in this call is to ensure one or two Nigerian research team is able to make it. And to make it, to this stage 1 scale through. And we will really need the support and guide of EDCP. We will, from Cognity Advisory, we will liaise with you so that if we need some pre-selection or some counsel about Nigerian team, I know Professor Gire will likely get in touch with you around that. We have not been benefiting sufficiently from the Horizon Europe call, though I know Professor Salako and the team, I know they do a lot of things in NIMA, but we really need the guide of your organization to see that one or two Nigerian or three, if possible, is able to make this call. So I'm just trying to say that we need your commitment in that regard to support the Nigerian NCP network and the research community to be able to learn the rope of getting through with this grant. Thank you very much.
Yes. No, thanks very much for that recommendation. It is also something we can discuss with the 3 members of the association from Nigeria. we also understand that Nigeria is very big, and we are interested in having, whatever information we have, widely disseminated, and that everybody benefits. So thanks for that comment.
All right. Professor Aboy, if you're ready, let's have your question.
Okay, good afternoon, and thank you very much. I know your call. I was trying to get in and was not opening on this side. That's why I have to put my hand again. Let me thank the presenters, both from the European Union and also the Cognitive Advisory. Just two questions I have. When you look through the calls from the horizon, one of the requirements is that you should have a partner from Europe. I want to find out, is it the EDTCP that actually allocate which partner, or how does one get a partner in Europe when you are putting on the proposal? My second question, I think, is for the Cognitive Advisory. Could you please throw more light on what you meant by idea analysis? If I did get you right, you say one of the things you do is idea analysis. Is it something like, if I have an idea for a proposal, it should first come to you people for analysis before one could write? Or what exactly do you do under idea analysis? Thank you very much. Over.
If I may start on the partners in Europe. So it is up to you as research grant seekers to determine which European partner you would want to bring in your consortium. Because normally this is a discussion we think happens between countries, institutions, and scientists outside the influence of a funder. But if you contact us and say, we are lacking partners in Europe, this is a program we have, this is a product, this is what we can offer, we do have a mechanism where we can kind of advertise that and, let other people who are interested on the other side to also contact you, and you start discussing from there. One of the mechanisms we have used is to have our regional networks that are already funded as the hub for linking partners. So they do have databases of industry, European country representatives that they are working with in the EDCTP funded work, but also sometimes outside EDCTP funded work, and they do help to make those connections. We also have the alumni platform, which has all the 400 plus fellows that EDCTP has funded in the past, where we also throw adverts or appeals. They have one email which every fellow sees on the dashboard, and we can help with a message that, Dr. Ngozi or Professor Ngozi in Nigeria is working on this area of research and is looking for people who are interested in there. And then once you get these responses to yourselves, then you can carry on from there. That's how we have been assisting. So we can assist in that manner if this is something you choose to go through us. I think the other question was for Cognity.
Okay, thank you so much, Dr. Tom. So about project idea analysis. When we send out calls, you write your concept note and share with us while we wait on your proposal. So through your concept notes, we are able to get an idea of what your proposal will be, what you think, and how you want to go about this proposal. And we are able to run through the idea, analyze the feasibility of this proposal idea in the concept notes, and give you our feedback and the possibility of it flying or not flying. More so, when you write your proposal, if you want, we can run through it and also give a feedback before it gets submitted. So that's what we mean by project idea analysis. I hope I answered your question. Dr. Madaki, Professor Madaki.
Yes.
All right.
Thank you very much. Yes, the questions have been answered. Thank you. Yeah.
All right, thank you. Let's have you, Professor Ngozi. You may unmute yourself.
Okay, thanks. I was just going to ask if the network is open for others to join, and if so, how do we join? I'm interested in joining that network, if we're allowed. Thank you.
Yes, Professor Ngozi, I think, as I said, we can link you to several network leaders. You just need to indicate to us or through the email I've given you which network you think would be most appropriate. For the West African one, which probably will be more suitable to your institution because you are already geographically there, the head of the previously funded EDCTP network is the MRC site in Banjul in Gambia, and Professor Hassan Jai is the one who is a leader there, and we can connect you with him.
All right, thank you, Dr. Tom. Any more questions, please, or feedbacks? If there is none, we would have Lydia, so she can tell us about EDCT from her end. Can we have you, Lydia? Dr. Tom, I think we lost her again, so she's not here. I can't hear you. Can anybody hear him?
Sorry. Sorry, I think if she has dropped off again, I don't know what you wanted us to clarify more, but otherwise, I don't have anything more from our side.
Right.
Yeah.
Because you mentioned when she joined, if she could say something about EDCTP. That's why I wanted to give her the floor.
Now, we agreed already that we will do a joint presentation. So the presentation I gave also represents her. I think we are fine.
All right, that's fine. Thank you very much. Errol, over to you.
Yes, from my side, I would like to thank again very much. It's really an honor to have Dr. Tom Nyirenda among us. His passionate and insightful presentation shed really light on the program's history, the key opportunity, the eligible criteria. I would like also to thank him very much for the valuable guidance for the two-stage application process to address, if I'm correct, the infectious diseases and pandemics, which is the key focus of EDCTP. And it was also an honor to welcome Dr. Lydia Boadren for her participation as well. So I think that I would like again to thank both of them very much for the time and yes, we can have, I think, a break of 15 minutes and join all together at 1 o'clock for the last hour of interday.
Thanks very much, colleagues, and thanks very much, Ero, for involving
Thank you
us.
very much. Thank you very much, Tom.
Thank you.
Thanks a lot again.
Okay, bye.
Okay, then see you
Thank you.
later at around 1 o'clock, right?
Yes, thank you.
Thank you very much. Mukwan.
Yeah, the end. Welcome back, everyone. I think we have 1 minute left.
Okay. I think we could start.
Yes, Errol, we can start.
Okay, wonderful then.
Okay.
Indeed, thank you for coming back and for staying with us. Now, indeed, after having seen the very insightful presentation from EDCTP, we are going to look at the implementation of a proposal. And in that sense, I would suggest indeed to consider the work plan and resources and the capacity of consortium or participant and consortium as a whole. As Dr. Thomas Nirenda has pointed out, as soon as your proposal passes through the first stage, it comes to the second stage, and regarding the second stage, indeed, one needs to show the work plan and resources as well as the capacity of participants and consortium as a whole. And you see here that the quality and efficiency of the implementation are important aspects to be taken into account. For instance, the work plan, and as I have already mentioned, the different type of risks to point out, the appropriateness of effort assigned to work packages, and the resources are important. Above all, what is also very important is the capacity and role of each participant and the extent to which the consortium as a whole brings together the necessary expertise. And indeed, when we have a work plan and resources, when your consortium will go through this type of project, there are maximum 14 pages to consider. And it's a brief presentation of the overall structure of a work plan, the timing of the different work packages and their components, a geographical presentation of the components showing how they are interrelated, detailed work description, a list of work package. Work package is the key concepts, and I will show you what it is about. Then, of course, it's also about a list of critical risks to point out related to project implementation, that the started project objective may not be achieved, and various table that I will show to you how to complete them. Above all, the methodology for work plan and resources is also an important aspect. A detailed work plan broken down into work packages, which should follow the logical phases of implementation of a project and include consortium management and assessment of progress and results. And here you can have as many work packages as you want. You could have 10, 15, 20 work packages, so that it distinguishes very well each of the work and the result you want to achieve. Any significant risk should be also identified and contingency plans described. For instance, describing the overall strategy of a work plan, show the timing of the different work packages and their components, providing a detailed work description broken down into work packages. We'll see what it is about with the work package list, the deliverable list, the description of each work package and summary, as well as the list of milestones, and providing a graphical presentation of the components showing their interdependencies. It is also important to show what are the resources to be committed. We will show what it means by justifying the main major cost in terms of human resources, equipments, travels, meetings. As it's a Euro-African project, that means that there are also costs to be taken into account regarding how one pays the different researchers, how it ensures that each researchers could meet in different countries, African and European one. Having said this, the capacity of participants and consortium as a whole is also very important. So when you argue for a project, it's important to do so. As Dr. Thomas Nyirenda has pointed out earlier, it's important to ensure that such a capacity is really there, and in that sense, the capacity of each Nigerian institution to reach out to other institutions is also an important aspect. The individual participants of a consortiums are described as a separate in section under Part A. I will show you what is the Part A of a proposal. Basically, it's the administrative part, and there is no need to repeat that information in this section of implementation of a proposal. So it is expected that a consortium describe itself. How does it match the project's objectives and bring together the necessary disciplinary and interdisciplinary knowledge? How this includes expertise in social science and humanities, open sciences, and gender aspect. You remember we have seen these elements this morning, including also the description of affiliated entities and associated partners. It is also important to show how the partners will have access to critical infrastructure needed to carry out the project activities, and especially clinical and health-related sectors. It is also useful that a consortium describe the members, how the members complement each other. And here the complementarity is very important. Another aspect, as you can see here, is the value chain. How each partners are going to contribute to this chain is also an important part to describe in the narrative. In what way does each of partners contribute to the project? It is important to show that each partner has a valid role and adequate resources in the project to fulfill that role. Indeed, we cannot take a partner like this. We need to show that the partners which are there are going to add value to this. Over countries and international organizations, if one or more of a participant requesting EU funding is based in a country or in an international organization that is not automatically eligible for such funding, then they are automatically explain why the participation of the entity in question is essential to successfully carry out the project. This means that, for instance, if you want, for instance, I would say an Indian partner, then of course that means that if you have indeed this type of an Indian partner, and you really want an Indian partner in your project, you need really to show that it has, I would say, an added value. If it doesn't have an added value, then it's very complicated. That's what they say over countries and international organizations. So it's better to stick in Euro, Sub-Saharan African partners and organizations. Of course, the management structure and procedure is also an important aspect. How the organizational structure and decision-making mechanism, and it should match the complexity and scale of a project. A few words on the decision-making mechanism. That means also, since you are in a consortium, and as Dr. Thomas Nyirenda has pointed out, a consortium needs to have at least 3 institutional partners. So question is the following: how these partners are making decisions? Are they making decisions on a consensual basis, on a majority basis, or on which basis? So this has also to be clarified and pointed out when writing such a project. In addition to this, regarding the individual participants, of course, behind any institutions, there are individual participants which contribute to the project implementation. What are the background and facilities? Who are the key person who are going, key researcher or key innovator who are going to work for the project? Is there any relevant collaboration either with the other partners or with any other institution, including the other EU-related projects? Role in societies, foundation, associations linked to the project. What are the tasks in the project of each of these individuals? Their main competencies, the scientific and demonstration, the method techniques that the consortium provide, the role in each of the work packages. If it's possible, to what extent the consortium fits in long-term scientific agenda related to clinical health, to strategy, and how it is key for the institution that you are presenting. That's why the strategy of your institution is also important to mention. If there are also you have national or international publication relevant to the project, it needs also to be explicitly pointed out. They are just maximum 5 publications which are expected. Conclusions for part 3, there are page limits. For instance, for methodology is 14 pages. For the consortium and the individuals, it's 3 pages. Please, if you are involved in such a project, pay attention to appropriateness of a management structure and procedure, so that you have also your say as an individual and as an institution. Look also that you are with quality quality and relevant experience, that your colleagues have quality and relevant experience. And thirdly, look also to the quality of a consortium as a whole. Is it complementary? Is there any balance? Because if all the partners are doing the same things, it won't work. So you need some complementarity in the chain value to ensure newness and contribution. One has also to look at the appropriateness of the allocation and justification of the resources to be committed, meaning that you need to have a budget. You need to have a budget for your staff. You need to have a budget for your equipment. And in clinical health, it's very important to have such a budget for equipment. So make sure that you have all of this and you have good working conditions. So thank you for your attention. I would like to continue on the implementation because it's not, I would say, it has also different parts that needs to really be pointed out. First is the list of work packages and a description of each work package. Here, there is an advice to limit the number of work packages, but don't limit too much neither. Use as much work package as you need. Show coherence in the division of work, I would suggest. Ensure unity within work package. And more than one partner per work package is better, so that you show that in each work package there is collaboration and multidisciplinarity and complementarity. A list of work packages resembles to this, but first of all, you need to mention, one needs to, a consortium, a Euro-African consortium need to mention what are the number of work packages, what are the title, who is leading the work package, is it your institution or another institution? Are they, who is the name of a lead participant? Short name. How much is it going to work? And this is calculated on the basis of person months. Let's say that your project longs for 4 years. So that means that it longs for 48 months. Out of this 48 months, the question that you should answer to is how many months am I going really to work for this project? Is it 6 months? Is it 10 months? So you need to point out the number of months that you are going to work for each of the work package, when it starts, when it ends, approximately, yeah? But you need to present an approximate narrative of the number of person months that you are going to use. The description of each work package is important. You have the work package for instance, the basic work packages are the one on impact, the one on coordination, the one on diffusion and exploitation of results, to communicate on results, because you need to communicate on the results that you are achieving outside of your consortium. So what is the number of your work package? What is the title of a work package? And here, what is also the objectives of your work package? And the participants involved in each work package and their efforts are shown in table 3.1 that we will see a bit later. And important is to describe the work in the work package. Who is the lead partner and the role of each participant? Are deliverables linked to each work packages well listed? You remember, it's also a key definition that we have seen is the deliverables. Is it a vaccine? Is it a report? Is it a new product that you are delivering? So this has to be pointed out here and described briefly. Having said this, it's better to have a maximum of 3 pages per work package or even more, because we see now that the Horizon Europe proposals are very straight to the point and very succinct, so there is a need to make an effort to be as short, but straight to the point as well. It is then important to divide the work packages into tasks, link between work packages, tasks, milestones, and deliverables, and show the role of each of a partner. What are the list of deliverables? Of course, it has to be listed, and evaluators are going to evaluate what the consortium proposes as deliverables. How many number are there? What is the name of a deliverable? Short description, please. To which work package is it related? Short name of a lead participant. What type is it? Is it going to be disseminated? If yes, how? What is the delivery date? First, deliverable key. What is key is that deliverable numbers in order of delivery date. Please use the numbering convention, work package number. For example, deliverable 4.2 would be the second deliverable from work package 4. Regarding the type, use one of the following code. If it is a document or a report, you name it AIR. If it's demonstrator, pilot, prototype, or plan design, it's DEM. If it's patent filing or website, it's DEC. If it's data sets, microdata, data. If it's data management plan, DMP. If it's ethics, then ethics, of course. If it's related to security issues, security, and others could be software, technical diagram, algorithm. The dissemination level, it could be public, fully open, or sen, meaning sensitive. Then they are also classified, but it doesn't really, it is not really related to EDCTP. And of course, when is the delivery date in months? For instance, if your project is 4 years and you expect to have your first deliverable in month 12, then you can mention that I'm expecting my deliverable in month 12. Indeed, the list of deliverables give full details. Base your account on the logical structure of a project and the stages in which it is so to be carried out. The number of work packages, of course, it is important to also enough detail in each work package. What resources are you assigning to ensure the implementation of a work package? For instance, if you are doing coordination, a work package on coordination with all your partners, you need to evaluate realistically how long are you going to take for coordinating a clinical health project. Please, you might also be required to update the plan for dissemination and exploitation of results, including communication activities. It's important to consider that this as an important part. You communicate not only inside your consortium, but also to others. For instance, if you have Nigerian research institutions which are not part of your consortium or other public health institutions, that would mean to consider also other aspects, and that would mean also to communicate and to diffuse information to them. This is part also of an open science approach. It is very complementary. Please make sure that the information matches the cost as stated in the budget that we will develop later. The number of person month shown in the detailed work package description. As I mentioned earlier, it will be also mainly the deliverables will be controlled by the European Commission or any other authorities which are looking at your project. So that would mean that you need also another key definition that we have seen this morning regarding implementation is the milestones. You need not only to list the deliverables, but you need also to list all the milestones. So what is the milestone number? What is the milestone name? Are there related work packages? The due date of a milestone, the means of verification. It is measured in months from the project start date. The means of verification show how you will confirm that the milestone has been attained. Refer to indicators if appropriate. For example, a laboratory prototype that is up and running. That would be, for instance, a clinical laboratory prototype that is up and running could be a milestone, an important milestone, because without that type of laboratory, you can perhaps not continue in developing other results of the project. So it's a very important and key milestones. Means of verification, for instance, through a report, through photos, through writings as well. Milestones indeed are control points in the time scale where decisions are needed with regard to the scale, to the next stage of a project. And here they are not deliverables, but can be associated with them. For instance, a major result has been achieved when its successful attainment is required to go to the next phase of the work. When the consortium must decide which of several technologies to adopt for further development. Having said this, you remember also that this morning we have also addressed a key definitions, which is risk. And here, of course, when you develop the implementation of your proposals or your consortium, your European partners are developing the project, it is also important to address risks explicitly. On the one hand, describe the risk, indicate the level of likelihood, and severity. Is the likelihood low, medium, or high? And if it occurs, is the severity low, medium, or high? And on which packages is it involved? Is it involved in the coordination work package, in the impact work package? And of course, sorry, of course, if it occurs, what are the proposed risk mitigation measures? How are you going to address this risk if they occurs? So this is also an important aspect to address. Another important table is the table showing the number of person months required. As I mentioned to you, the person months is the number of months that each person in the project is going to work during the whole course of a project. And their participant number, short name, in which work package is it going to work? Is it the work package 1 or 2? And how many months is it going to work? So it should be coherent with the other tables, and you can do it at the end. Of course, all the activities that you are doing in a project could not necessarily be organized by all the partner consortiums. So sometimes you might need to do some subcontracting. So for instance, if you want to have a website or to organize an activity outside your institution, you might need another organization who does this. And it is important to have an evaluation of the cost and the description of task and justification in that sense. There are also travel and subsistence equipment and other goods. In particular, I would like to point out that in clinical health, equipment are eligible to be and you can buy it for your institution. Travel and subsistence are also allowed. So if you have to go to Europe or to any other African country, they are also eligible. So make sure that you have also that type of money and amount for you in your institution. If there are any other cost categories, please do not be shy to mention them. And if there are in-kind contribution from other organizations, it could be, for instance, other small, mediums and enterprises, or other health organization, or other EU fund, other funding agencies, then of course it could help to actually mention them. And indeed, you have an idea now of how it does look like to have a proposal template part B, technical description. We have here the number of participants with a special mention to the coordinator, and actually the coordinator is the one who is supposed to write from scratch or has at least the coordination of a project. So it's very important. Important to remind that the excellence, objective and ambition of a project, the methodology, the impact that we have seen, which has to be described in terms of project's pathway towards impact, and also measures to maximize impact, such as dissemination, exploitation, and communication. Another table that, that is required to complete is the summary of a key element of the impact section. What are the specific needs that triggers your project? What do you expect to generate by the end of a project? These are the results. What are the diffusion, exploitation, and communication measures that you intend to apply for your results? And also, who will be, who will use the results, who will benefit from the results? These are the target groups, a key concept. Outcomes, what change do you expect to see after successful dissemination and exploitation of project results to the target groups? So what will be the outcome? What will be the changes for them? And impacts, what are the expected wider scientific, economic, and societal effects of a project contributing to the expected impact? So here I shared with you, and Cognity could share also with you all the PowerPoints that I sent to them. You have also example with airports and electronic components and what it means in terms of specific need, expected results, and target groups, outcomes, and impacts. Having pointed out this proposal template part B regarding implementation, it's thus important to show work plan and resources, the capacity of participants and consortium as a whole, as well all the template that I mentioned to you, the list of deliverables, of milestones, the critical risk, the summary of staff report, the subcontracting, the purchasing cost, overcost, in-kind contribution, as well as the work package, which are also important to consider and mention. Having said this, and last but not least, I would like now to after having seen with you what is a Form B of an EU proposal related to global health on European and developing countries clinical trial partnership, I would like now and having presented to you with also our colleague from EDCTP, the programs, the calls, the part A, which encompasses excellence, impact, and implementation. There is now the Form A to consider. Remember, it is a key distinctions that we have seen here earlier. between, on the one hand, the administrative form part A and part B, excellence, impact, quality, and efficiency of implementation. But part A is also a very important aspect to consider. One has to carefully spend time to write this approach. So indeed, when we go to form A structure, we see that there are basic ideas to provide, such as the participants, giving data on the organization. Is there a gender equality plan? What are the budget of a proposal? This is, of course, the most important aspect. The ethics and security, ethics issues table, ethics self-assessment, security issues table, and also other questions. Well, when it comes to administrative data and status of your organization, you remember that we have also seen something which is also very important. It is that you have dependencies with another organization. And this is something which is key. As Thomas Nyirenda said, it's better to have an independent relation from in the consortium, from different parts of the consortium. And this is typically a part A that could be completed with type of model, grant agreement, proposal number, acronym. Here, the acronym, it's you, but you have to provide an acronym. Except this, it's important to give general information, the number of participants, the budget, the ethics and security, and other questions. So, yeah, any proposals need a title, so important to provide a title. How long is the proposal going to be implemented? Important to mention this. Are there keywords? Please mention them. And also, don't hesitate to write an abstract of maximum 2,000 words. General information, as you can see, it's basically what I just mentioned regarding the need for acronym, for a proposal title, for duration in months, fixed keyword, fixed also free keywords as well are also eligible, and also an abstract. Don't forget the abstract. As soon as you have this, it's also important to answer very quickly to all these questions. It doesn't take too much time. It's, for instance, we declare to have the explicit consents of all applicants on their participation and on the content of these proposals. We declare to be fully compliant with the eligibility criteria. So it's really, we confirm that for activities carried out outside the Union, the same activities would have been allowed in at least one EU member state. Additional options for lump sums. For lump sum grants with a detailed budget table, we understand and accept that the EU lump sum grant must be reliable proxies for the actual costs, meaning that you can have an idea of a budget that you intend to use, and it is an approximation of what could be really spent in the future. That's about the meaning. Having said this, another important part is the participants. So it's important to list all the participants and from which country are they. Are they from Nigeria, from Ghana, from Belgium, from Romania, from France, from Italy, Germany, or Hungary? You need to mention this. Having pointed out this, what is the legal name of the institution? Does it have a participant identification code? The addresses, these are, is it a non-profit, a public institution, a research organization, all this, or an SMEs? All this has to be pointed out, actually. If it's a department, carrying out the proposed work, what is the name of the department as well. And this has to be a lot of administrative aspect, but they have to be completed because an expert is going also to look at all this. Who is the main contact person? Is it a woman, a man? What is the position in the organization? What are the other contact persons? So you see that all this information need to be provided. Above all, who are the researchers which are involved in the proposals? Title, first name, last name, gender, nationality, email, career stage. Is it a top grade researcher, a senior researcher, a recognized researcher, or a first stage researcher? Role of a researcher in the project. What is he doing? Is he a leader, a team member, a developer, an innovator? This has to be also specified. And if your institution is participating to the project, what is it doing? Is it doing project management, communication? Is it providing research? Is it a finance provider? Is it a technology developer? Is it a private buyer of results? So you need to click on what is relevant about this. Of course, list up to 5 publications widely used datasets, software, goods, services, or any other achievement relevant to the call content. Every time you will see that the European Union, especially in the field of research, is going to ask for publication. And also what has been the 5 most relevant previous projects or activities connected to the subject of these proposals. So for instance, if it's about, you are talking about clinical health, you cannot really talk about history and list a name of a project related to history or economics. It has to be related to clinical health. Description of any significant infrastructure and or any major items of territorial equipment relevant to the proposed work. It could be that in your institution you have a very important equipment, and if you are going to use this in this project, it's important to mention what this equipment is about. Gender issues and gender equality plan. Please don't forget that it is important to describe and to contribute describing. The Europeans can do this because you are in a Euro-African project. Describe action that would be undertaken during the course of a project to promote gender equality in your project or in your field of research. Examples, action aimed at a wider public, events organized in schools or universities. This is how a gender equality plan looks. Do you have or not a gender equality plan? And then afterwards, it's about are you integrating or not the gender dimension into research and content? These are an important question to complete in a Form A. What is, of course, very, very important is also the funding. And if you go to the system of lump sum funding, as a reminder, some of the call for proposals here that I showed you are using a lump sum, for instance. Here, the Global Collaborative Action for Strengthening the Regional Networks of Excellence and Epidemic Preparation Consortia. Here it allows lump sum. And of course, what does lump sum mean? In financial terms, it's very important because it needs that it's not necessary to have a financial audit. It's not systematic. It could be, but it's not systematic. One needs to know that before in other Horizon Europe programs, we call that Horizon 2020, for instance, or Framework Program 5 or 6 or 7, it was most of the time compulsory to have an audit, a financial audit, and it takes, as you know, a lot of time and energy to have all the papers, to spend time with an auditor. But with a lump sum funding approach, for instance, for the network, no needs now to have really timesheets or invoices or travel tickets. Of course, the budget must still be realistic and well justified, but no longer leads to this, and this is very important. Of course, it depends if your internal rules pushes you to have timesheets, contract invoices, or travel tickets. If not, then fine. But if yes, you need then to comply to this. The advantage of a lump sum is that it reduces administrative burden, allowing focus on key tasks, such as the substance of the projects. And I can assure you that from experience that when we used to prepare to financial audit, it used to gather a lot of our energies, and I'm very happy to see that the European Union and Horizon Europe has put for a while the lump sum approach, meaning that you don't need to have this financial and administrative burden. You have it, but it's very significantly reduced, and it leaves you very comfortable to do other tasks. However, the European Union and the African Union or any institutions which are going to control the implementation of your project are going to see if you have provided the technical reports, if you have prototypes, if you have your deliverables, if you have your communication materials, as it has been developed in the narrative of your project. So it's very important to take into account that what you are doing is going to be audited, especially when implementing the project. So that says that the European Union is focusing on what you are doing during the implementation and what are the proof that you can provide to the European Union that you are active enough. And then, of course, you have this lump sum budget where you need to say, at least, of course, you are not audited, but when you prepare your budget, you need to say what are the personal costs. So that means, for instance, in your institution, you have 3 researchers who are going to work. You need to say, well, this is the price for this type of project. It costs us, for instance, that amount of money, $3,000 or $4,000 per month on a monthly basis. And you need to calculate this. You need to calculate if you subcontract, if you take another enterprises to do part of a job. Are you spending money on demonstration, coordination, management? This has also to be pointed out. For instance, the main categories are personal costs, mainly could be as a synonym, you can use salary, subcontracting, meaning that it's more you are working with another institution to actually do part of a job. Purchase cost, there are 3 main purchase costs: travel and subsistence. Equipment, above all, is very important. If you are involved in this project, that means that you can have the right to ask for equipment, especially in the field of clinical health. Other goods, works, and services are also important. Having said this, it's also important to show you this budgetary table. It's not really complicated, actually. Each participant's meaning, for instance, if you are a Nigerian participant, you could be participant 1 Nigeria NG, which means your country. How much you are asking for personal costs in terms of €1,000. What are the subcontracting? Are there travel and substance costs? Are there equipment costs? So you actually give as much as information as you get to the budget, so that when you implement your project, you have access to this budget and you can use this budget for personal cost, travel, and equipment, for instance. Yeah. Having pointed out this, there are also ethics and security issues. And here, among other, and since it is linked to health, special attention could be given to human embryonic stem cells. Research proposals that will involve human embryonic stem cells will have to address all the following specific points. You need, for instance, the measure taken to protect personal data, including genetic data and privacy, for instance. If you use animals, also number of animals should be specified, describe what happens to the animals after the research experiments. So this has to be, of course, ethical issues that has to be addressed. And you have here an ethical table, yes or no. Does the proposal involve children? Yes or no. Does the proposal involve patients or persons not able to give consent? Yes or no. Does the proposal involve adult healthy volunteers? Yes or no. Human genetic materials. So you need on the research on human embryonic or fetus, does the proposal involve human embryos or not? Privacy, research on animals. Does the proposals involve research on animals? So there is a table also here to complete in that sense. Having said this, there are can be really exhaustive regarding ethical issues, but my advice would be go straight on the point, be as short as possible, and try to go straight on the point, please. This is, for instance, what it looked like on Horizon Europe, an ethics and security table to complete on human embryonic stem, on humans, on human cells and tissues, on personal data, on animals, in non-EU countries. And since Nigeria is a non-EU country, you will have to answer to these questions. Will some of the activities be carried out in non-EU countries? Of course, yes. Specify the countries. Nigeria. In case of non-EU countries are involved, do the activities undertaken in these countries raise potential ethical issues? Yes or no? So there are plenty of questions to mention here. Also regarding the material. Is it planned to export any material over than data from the EU to non-EU countries? If yes, what are the materials? And I can imagine that clinical and health material could really be exported to Nigeria if Nigeria do not have these materials over there. Other ethical issues are environmental, health, and safety. Does this activity involve the use of substance or process that may cause harm to the environment, to animals or plants? So it's really important to show this, as well as artificial intelligence. Does this activity involve the development, deployment, and or use of artificial intelligence-based systems? Are there concerns for human rights and values? This has to be also to be answered from an ethical point of view. There are also ethics self-assessment. If there are any problems, comply with ethical principle and relevant legislation in Nigeria and in the EU member states. It's important to mention this. Are there security issues, misuse? Does this activity involve materials requiring protection against unauthorized disclosure? So does this activity have a potential for misuse of results? So this has to be, of course, mentioned on this. So there could be also other questions and in a two-stage calls. And since the EDCTP3 is a two-stage call, it must be consistent, the proposals, with different stage A and stage 2. And if there are any, I would say, differences between the proposal submitted in stage 1 and stage 2, one has to point out, is it related to partnership? Is it, does the budget has changed? Is the approach different? So all this, of course, has to be pointed out. Are clinical studies, trials, investigations included in the work plan of these projects? And in EDCTP3, of course, one could expect that it is included in that sense. So having said this, I would like to thank you very much for your attention. I think that we have here the possibility to have a question and answer session if you like. So if you have any questions related to how a project could be written and the 2 stages, I am of course available in the context of EDCTP3. So perhaps we could see, for instance, if with collaboration with Omukfon, if there are any questions that you would like to ask, please, the floor is yours for a question and answer session.
Thank you, Errol.
My pleasure.
It was insightful. So please, if we have questions, come indicating by raising our hands. Okay, doesn't look like there are questions. I guess you were clear enough. Okay. Professor Ajayi, I think you want to address us, Cognity Advisory. Prof, sir.
I was wondering if you don't have questions, perhaps it's time to conclude. Perhaps is Professor Faborode around us?
Yes, he's here.
Yeah, okay. Perhaps we could say, I would like to please ask him if he is available then for, say, some words of conclusion, please.
Okay. Professor Faborode, please, could we have you? Errol, you have a mail. Please check your mail.
Yes.
Going to try to check it.
Sorry, thank you very much, Errol. I had to quickly attend to some assignments, and but I want to presume that the info day has gone well, and that and to thank you for bringing in our colleagues from the EDCTP to shed more light on the call and the wonderful work that you've done in putting up the team together between European countries and African countries. And I think that's the way to strengthen this such engagement. So thank you very much for the special event of today. I want to thank all our NCPs, particularly for help who have been part of this since this morning. We're looking forward to the fact that we get before the deadline a number of submissions. I'm happy to report that we got a few more submissions for the VET program, which closed February 28th. So we are looking forward to this special call again, especially for those of our colleagues in the public health area. So whatever it's possible to still be able to provide some assistance, please do not hesitate to link up with secretariats who are cognitive. On this note, I'd like to appreciate consultants from ICON and from Europe Limited. Dr. Errol has actually been very, very supportive and proactive. And I think today has been a revelation of what can do in supporting the cause of the NCP system in Nigeria. So thank you very much, and thank you also, colleagues who have participated. And I also want to thank Cognity for making sure that we have this connectivity and the program has gone well. Thank you very much.
Thank you so much, Professor Faborode. I would like also just to take a few words and to thank you very much for your support to organize this event, without which it would not have happened. I would like also to thank also the Nigerian researchers and participants in the field of health who have been here. We have been who have followed the Info Day, and also who have asked also relevant and very interesting questions to our guest from EDCTP. And what I think is important is that you know also that EDCTP programs belongs till 2031, so 6-7 years. So there are every year calls for proposals, and it's important that the strategy of your institution takes into account also EDCTP to address all the possibilities. And of course, here Cognity Advisory is also there to support you regarding the EU projects. And also I would like to thank Omokfon and also Dr. Tom Nyirenda and Dr. Lydia Boadren. They are not here, and also Professor Adomu Bakari. And above all, thank you very much, Omokfon, and also thank you so much, Professor Faborode, and all the Nigerian participants here. Thanks so much.
Thank you so much. It was good having you. Thank you for making working with you seamless. And Professor Faborode, thank you very much for the support and guide. Thank you, everyone, for participating.
Okay. Thank you very much. Bye-bye.
Bye.
Bye-bye.
Bye. Bye.